तो टेम्पोरल आर्थराइटिस पे क्वेश्चन आया है, कावासाकी's डिजीज पे आया है, माइक्रोस्कोपिक पॉलीएंजाइटिस. So we are going to just have a quick recap about the important features of all of them. So if I'm talking about temporal arthritis, this is the most common example of a vascularity disorder that is going to be seen in case of adults. The classical complaint of the patient is going to be the presence of a headache, right? The patients are also going to be having, apart from headache, the reason for the headache, of course, is going to be inflammation at the level of the superficial temporal artery, which is going to be responsible for having the anatomical location in the lateral margin of the forehead. So that is what is going to be causing the trouble in the patients. Apart from that, the patients are going to be having a very characteristic feature, which is given the name of jaw claudication. It's an example of a vascularity disorder, which is going to be associated with the presence of a very high value of ESR. So that's a very unique finding of this vasculitis, high value of ESR. And the patients are going to be having the presence of polymyalgia rheumatica, right? A lot of you were mentioning in your chat that you are not able to recall everything that is being discussed over here. So please don't worry. This is absolutely normal. But it should not be also a situation जहाँ पे आपको सारी ही चीजें नहीं लग रही हैं. मतलब if you are talking about 100 points, let us say if I'm talking about, let's say 20 points of micro pharma or let's say medicine, then if you're finding all the points to be new, then definitely there's a cause of problem. But if you're finding that there are some features that you're not able to recall, it's very much normal. Don't worry. Right? So the important thing is that at least the topics which have been asked in the exam, we develop a more command to it. So writing it down with your own handwriting, reading it down loudly to your own self, that is the only solution. And everybody can be having a problem in different kind of troubles. Na? Matlab, I can be having a problem, let us say, in understanding immunity. Somebody else can be having a problem in neoplasia. Somebody else is going to be having a problem with regards to, let us say, GI tract. Somebody can be having a problem in markers. So you identify your own weak areas, your own gray areas, and work on them, right? There are things that we unconsciously or subconsciously tend to do. Say, for example, that, I know something, then I have a habit of reading about the same things time and again. It's a fascination that people have. Let us say for reading about and remembering the names of all the monoclonal antibodies. This is just not acceptable. You are not going to be remembering all the monoclonal antibodies. Why I'm asking about these drugs is some of them are more important than others. So in case you get a question in the exam, at least if I am pushing you to read about a new monoclonal antibody or a new drug, अभी आप में से काफी सारे लोगों को एटलीस्ट ये पता चल गया होगा कि हाँ, पेगसीटाकोप्लान एक दवाई होती है जो पीएनएच में देते हैं. There is another drug apart from eculizumab that is also available in PNS. So in the exam, automatically ravulizumab will be, floating in your mind. But if you are not even aware about eculizumab, then there is obviously going to be a trouble. So if you have heard about certain things, of course, you are going to be having a higher chance of recalling that in the exam comfortably. Right. So coming back to our discussion over here. So headache is going to be the most common complaint of the patient. The most specific complaint of the patient is going to be a jaw claudication, high value of ESR, and the patients are going to be having polymyalgia rheumatica. This condition is being asked in the exam time and again, as we talked about in the mission class as well, for the simple reason that patients can be having a sudden onset of blindness. That's a dreaded complication so far as this condition is concerned. Now, in order to reduce the chances of development of blindness in this patient, you are going to be giving this patient IV steroids because you do not want to have the involvement of the retinal artery of these patients, right? If at all you have to make a confirmatory diagnosis, that is best done with the help of temporal artery biopsy. And biopsy is going to be showing you a damage at the level of the vessel. What kind of damage would you find? You are going to be having a damage at the level of the internal elastic lamina. And what you are going to be having in these patients is that there is an extreme narrowing of the lumen. So what you can appreciate over here is also going to be the fact that there is presence of giant cells over here. So temporal arthritis is an example of a condition in which the patients are going to be more than 50 years of age and they are going to be having a granulomatous vasculitic disorder. Granulomatous vasculitic disorder. Damage at the level or fragmentation of the internal elastic lamina is going to be a characteristic finding that is going to be seen in the patient. Now, similar findings, if they are going to be seen in a patient who is going to be less than 50 years of age, then you will change your answer. You will change your answer then to a condition that is given the name of Takayasu arthritis. Takayasu arthritis. Takayasu arthritis is also called by the other important name of aortic arch syndrome. That is well given in your notes. You just have to remember. It's an example of a condition which is also going to be associated with involvement of the subclavian vessel. Because of involvement of the subclavian vessel, the patients are going to be having very weak pulse or feeble pulse. Sometimes it can be so weak that you are just not able to palpate it. And therefore, that is going to be given the name of a pulseless disease, right? This is what we are talking about as of now. So this is what we are talking about Takayasu arthritis. It is going to be also called by the name of pulseless disease in the patients. Now, Takayasu is having a hint itself and the name itself. It's a problem of young adults. Another reason why they ask you a question on Takayasu disease is because of the fact it is a very important cause of development of renovascular hypertension in case of young adults. If I just revise that for you, renovascular hypertension in case of elderly people in India as well as abroad happens to be atherosclerosis. But in case of Indian population, or for that matter, even the South Asian population, the common reason for development of renovascular hypertension over here happens to be a condition that is going to be given the name of Takayasu arthritis. That is what you need to remember. As I say, it is going to be similar. As I say, it is going to be similar to temporal arthritis. So this is also an example of a condition in which the patients are going to be having the presence of granulomatous inflammation. That is what you need to keep in mind, right? When we are talking, asked a question in the exam on Kawasaki's disease 2023, we got a question in the exam. Patients are going to be diagnosed. It's a pediatrics question, which is going to be the criteria that is useful for making a diagnosis of this condition, fever plus cream criteria. Of course, you know that what kind of conjunctivitis do we have in these patients? It is non-purulent conjunctivitis. So this was one of the questions asked in the exam. Patients are going to be having the presence of a rash that you need to remember. Patients are going to be having the presence of unilateral cervical lymphadenopathy. Patients are going to be having the presence of edema of hands and feet, edema of hands and feet. And of course, patients are going to be having mucosal involvement, which is in the form of development of what all of you are correctly talking about. The patients are going to be having the presence of what is given the name of a strawberry tongue. Strawberry tongue. We remember the fact that this is a condition which is going to be having the involvement of skin as well as the mucosa. So it is also given the other important name of mucocutaneous lymph node syndrome. Mucocutaneous lymph node syndrome. Kawasaki's is going to be causing a trouble in a patient because the patient is going to be having the presence of coronary artery aneurysm. And when you are going to be having a coronary artery aneurysm, which is going to be depicted over here, the coronary artery is going to be having a narrowing of the lumen, because of which the patients are going to be having development of myocardial infarction. Some patients who are going to be having Kawasaki's disease are having the presence of anti-endothelial cell antibodies, anti-endothelial cell antibodies, and quite a number of these patients are going to be having increase in their platelet count. Now, you cannot do anything for the anti-endothelial cell antibodies except that you can be removing them with the help of immunomodulator drugs. So these are going to be reduced with the help of IVIG. And so far as the platelets are concerned, you can decrease the activity of platelets by giving antiplatelet drugs. Of course, most of you are aware, the most important example of an antiplatelet drug that we are going to be giving is going to be aspirin. Which dose of aspirin is going to be having selectively antiplatelet action? I want you to recall that. That's going to be the easy one. Which example of this particular condition is going to be having the presence of? So it is going to be a dose which is going to be, हाँ low dose का मतलब क्या होता है, वही तो पूछ रहा हूँ मैं आपसे, 40 से लेकर 325, 40 से लेकर 325, 40 से लेकर 325, और 40 तो मिलती नहीं एग्जाम मतलब मार्केट के अंदर. सो द डोज दैट इज अवेलेबल ओवर हियर इज गोइंग टू बी 75. सो 75 का 4 टेबलेट देते हो, अडल्ट को आप 300 मिलीग्राम देते हो. लेस देन 325 इज व्हाट यू नीड टू रिमेंबर. Suppose a patient takes extra amount of aspirin. What is the toxicity called as? If a patient is going to be taking extra amount of aspirin, what is the toxicity called as? I want you to recall that. टॉक्सिसिटी यार, एडल्ट नहीं लगा डेली, सेलिसाइलिज्म बोलते हैं. रे सिंड्रोम कब आप बोलते हो? रे सिंड्रोम आप बोलते हो व्हेन अ चाइल्ड इज हैविंग द प्रेजेंस ऑफ viral fever, and instead of giving paracetamol or instead of giving a drug like mefenamic acid, you give aspirin to a child having a viral infection, right? So that is different. रेड सिंड्रोम तो अलग होता है डॉक्टर मनीषा. रेड सिंड्रोम तो यार चीज ही अलग बोल रहे हो आप बिल्कुल. ठीक है, रेड तो लर्निंग डिसेबिलिटी डिसऑर्डर के साथ में आती है आपकी. ठीक है, ये इंपॉर्टेंट चीज आपने ध्यान रखनी है. अदर एग्जांपल ऑफ अ कंडीशन दैट इज गोइंग टू बी सीन इन केस ऑफ चिल्ड्रन हैपेंस टू बी IgA vasculitis disorder. IgA vasculitis disorder. So these are the patients who are going to be having a history of upper respiratory tract infection. There is overproduction of IgA antibody. This IgA antibody is going to be causing an involvement of the skin. It is going to be causing involvement of the kidney. It is going to be causing involvement of other important areas of the body, say for example joints, and it is going to be causing involvement of GI tract. So this condition is given the name was earlier called as Hinox-Schönlein purpura. But what you need to remember over here is that these patients are going to be having the development of glomerulonephritis. They are going to be having the presence of extensor surface rash. Extensor surface rash. They are going to be having the presence of joint pain. Patients can be having abdominal pain as well, or they could be having even the development of blood in the stools as well, right? And this is an example of a condition which is going to be associated with the term non-thrombocytopenic purpura. Non-thrombocytopenic purpura. Why do we need to talk about IgA vasculitis? Is because of the question that was asked in the exam. A lot of these patients, especially when the patient is going to be having an active GI bleed, when the patient is going to be having an active GI bleed, that is one important indication. And second, if the patient is going to be having severe kidney inflammation. Severe kidney inflammation का मतलब होगा if the patient is going to be having RPGN or if the patient is going to be having GI bleed, then you start these patients on steroids. Indication of steroids in these patients, RPGN and GI bleed. That was what was asked to you as an INI question. Right? Otherwise, what they ask you in the exam is that this is an example of an immune complex disease. So it is an example of a type 3 hypersensitivity reaction. Right? So it is quite similar to what we talked about in case of patient having Burgers. Burgers में भी IgA involved होता है. बर्जर्स में भी हिस्ट्री ऑफ यूआरटीआई होती है, बर्जर में भी ग्लोमेरुलोनेफ्राइटिस होता है. But the important point is Burgers is a problem of adults, whereas IG vasculitis is going to be a problem that is going to be seen in case of children. Remember the fact that these patients are going to be having what is going to be given the name of a vasculitis disorder. So they are going to be having dermatology question, palpable purpura. They're going to be having palpable purpura, non-thrombocytopenic purpura. It is also having a third name, anaphylactoid purpura. Non-thrombocytopenic purpura, palpable purpura, anaphylactoid purpura. That is what you need to remember about IG vasculitis. Right? Then the example of a condition that is going to be seen in case of young male smokers is going to be given the name of Burgers disease. So this guy is going to be a young adult. He is going to be typically a male and he's going to be having a history of smoking. As a result of which there is involvement of the medium-sized vessels and there is going to be a development of a thrombosis in the vessel. Because of thrombosis in the vessel, almost the complete vessel lumen is going to get occluded. Right? There is complete obliteration over here over. So this condition is what is going to be given the name of thromboangiitis obliterans. Therefore, the patients are going to be having the development of intermittent claudication, or they could be having the development of Raynaud's phenomena-like manifestations. So these patients are typically going to be having intermittent claudication, and the best advice that I would like to give these patients after doing a color Doppler, after calculating the ankle brachial pressure index, is going to be that you are going to be asking this individual to quit smoking as well as give him vasodilators. If the patient is not going to be following your advice, then this patient is always in a high risk of development of gangrene for which amputation may be required. Right? So what you're going to be asked in the exams are going to be simple facts, the classical history of a young male smoker who's going to be having a discomfort in the upper limbs, and the patients can be having involvement of the lower limb as well. Commonest vessel that is going to be affected in these patients is going to be the tibial artery. Remember the fact the patients are going to be having an important finding that there is going to be a sparing of the lymphatics so far as the patients are concerned. Right? The other thing that we need to remember over here is a patient who's going to be suffering from. Apart from this, I want to talk about a condition that is going to be given the name of polyarthritis nodosa. Polyarthritis nodosa patients are going to be young adult patients who are going to be suffering from hepatitis B infection. Because of the formation of immune complexes, patients are going to be having patchy involvement of the blood vessels. These patients are going to be having multiple organs which can be affected. But what we need to remember in these patients is pulmonary artery is not affected. Pulmonary artery is not affected. Similarly, if I talk about the kidney involvement, kidney is affected in these patients, but glomerulonephritis is never seen in these patients. That's another important thing that you need to remember in the exam. Patients who are going to be having polyarthritis nodosa are going to be having the presence of the type 3 hypersensitivity reaction. So whenever you're going to be having immune complex formation, it is automatically associated with the presence of fibrinoid necrosis. That's another thing that we have talked about. Fibrinoid necrosis, that is another thing that we have talked about. Then we talk about anti-neutrophilic cytoplasmic antibody. Why did we talk about anti-neutrophilic cytoplasmic antibody is that these are example of vasculitic conditions and these patients are going to be having the development of high risk of RPGN, especially which type of RPGN will you associate in these patients, type 1, type 2 or type 3. These patients are going to be having type 3 RPGN. Two types of ANCAs that are going to be seen, one which is going to be given the name of MPO ANCA and the third one, which is second one, which is going to be given the name of PR3 ANCA. MPO ANCA is an example of a ANCA in which the antigen over here is myeloperoxidase. Myeloperoxidase. So this was earlier called by the name of P ANCA. PR3 ANCA is the antibody in which the antigen over here is going to be given the name of proteinase 3. So this is what was earlier called by the name of C ANCA. Now you're going to be having multiple conditions which can be showing you this. MPO ANCA can be seen in case of a condition. MPO, remember the fact, microscopic polyangiitis. Can be seen in a patient who's going to be having suffering from Churg-Strauss syndrome. Can be seen in a patient who's going to be suffering from Goodpasture syndrome. And can be seen in a patient who's going to be suffering from ulcerative colitis. Out of all these, the strongest association that you need to remember over here is microscopic polyangiitis. So you got again a question in the exam INICET in which they were asking you a question on something like microscopic polyangiitis. And exactly what was asked to as a question in the exam over here was the fact that the patient was having the presence of posse-immune glomerulonephritis. Posse-immune glomerulonephritis means the patient is having type 3 RPGN. The question that gave you the hint in the exam was the patient was having the involvement of the skin that is in the form of palpable purpura. The question also made a mention of the fact the patients were having the presence of MPO ANCA positivity. MPO ANCA positivity. So patients can be having presence of malaise. They could be having muscle pain. Myalgia can be there. They could be having skin involvement in the form of rash. But the hint in the exam question was that in these patients, pulmonary involvement was there. Glomerulonephritis was there. MPO ANCA was there. Remember, MPO ANCA is not seen in case of a patient who is going to be having the presence of polyarthritis nodosa. Patients are not going to be having the involvement of something like, yes, the image is reversed over here. I hope you can make that out. So this is going to be the presence of an antigen that is going to be the presence of something like the perinuclear, the cytoplasmic ovarian staining. It is good for you to notice that. This is what we need to remember. The classical meme of Akshay Kumar is what I'm remembering as of now over here. So this is going to be having the presence of a cytoplasmic staining, the MPO ANCA, whereas the PR3 ANCA is going to be having the perinuclear staining. That is what we need to remember. This one is going to be cytoplasmic. This one is going to be perinuclear. My point that you need to be remembering over here is going to be the fact that the patients are going to be having an important finding. That is what is to be kept in mind so far as the clinical presentation of the patient is concerned. That's what we just need to have an idea. And just one condition about which I want you to have an idea so far as the PR3 ANCA is concerned. The PR3 ANCA is going to be seen in a patient who's going to be suffering from a condition that is called as GPA. GPA is granulomatosis with polyangiitis, granulomatosis with polyangiitis. And this is the one which is going to be associated with the fact the patients are going to be having the development of the earlier condition that was called as Wegener's granulomatosis. So you need to be familiar with these conditions. You need to be familiar with GPA, and I hope that we're going to be having a discussion about GPA over here. So GPA is going to be associated with the patients who are going to be having the involvement of the kidney. Patients are going to be having the involvement of the lungs. Patients are going to be having the involvement of the lungs. And of course, you're going to be having the patients who are going to be having the involvement of the upper respiratory tract. Now, what is going to be seen in these patients is that if I am talking about only kidney and lung problem, this is going to be seen as a feature of a patient who's going to be suffering from Goodpasser syndrome. But if the question makes a mention of something like, let us say, septal perforation, if the question makes a mention of something like otitis media, question makes a mention of something like the presence of pharyngitis, of course, I will be thinking in terms of ENT trouble. So ear, nose, and throat. So this is the golden rule that we need to talk about. Renal involvement, upper respiratory tract involvement, lungs involvement, that is what is seen in a patient who's going to be having this. Patients who are going to be having Wegener's granulomatosis are going to be having granulomatous inflammation both in their lungs as well as in their upper respiratory tract. They do not have granulomatous inflammation in their kidney. Remember that INI question. They do not have granulomatous inflammation in their kidney. What are they having in their kidney? They are going to be having a high risk of development of RPG. Another important finding which is asked in the exam is the patients who are going to be having this condition, which is called by the name of GPA, are going to be having swollen gums, which are going to be given the name of strawberry gums. So when we are talking about strawberry tongue, that's a feature of scarlet fever, as well as that is a feature of a patient who's going to be suffering from Kawasaki's disease. But strawberry gums is going to be a feature that we need to remember in context of GP. MPA के अंदर डॉक्टर अनुकृति we are going to be having a patient who is going to be having microscopic polyangiitis, मतलब small vessel disease है. पहली चीज समझ में आ गई. So patients are going to be having myalgia. They are going to be having cutaneous vessel involvement, skin rash हो जाएगा, myalgia हो जाएगा. These patients are going to be having glomerulonephritis because glomerulus contains arterioles. These are small vessels. They are going to be having pulmonary involvement as well because pulmonary capillaries are again small vessels. So there is going to be pulmonary hemorrhage. And the patients are going to be having the presence of an ANCA. What kind of ANCA would you associate it over there? MPO ANCA. ठीक है. So आपने MPA के साथ याद रखना है. MPA के साथ MPO ANCA. Right? So I said you polyarthritis nodosa. देखो इसको आप बोलते हो microscopic polyangiitis. This is not to be confused with polyarthritis nodosa. Polyarthritis nodosa is a medium vessel disease. Microscopic polyangiitis is a small vessel disease. In polyarthritis nodosa, pulmonary involvement is not seen, glomerulonephritis is not seen. In microscopic polyangiitis, both of them are affected. Right? And you have an antibody in case of microscopic polyangiitis, which is given the name of MPO. So this was asked to you as an INA question. Coming back to the discussion over here, Wegener's is also asked in the exam, GPA. This was having a very poor prognosis just about 20 years back. But thankfully to an example of a drug which is given the name of cyclophosphamide, which is having immunomodulatory action also, we have been able to tackle this kind of a condition. Cyclophosphamide, hemorrhagic cystitis, aldophosphamide, and the association with MESNA. I hope you know all the three questions. Then we are going to be talking about an example of granulomatous vascular disorder. So I just want you to recall over here, temporal arthritis, Takayasu arthritis, Berger's disease, granulomatosis with polyangiitis, eosinophilic granulomatosis with polyangiitis, which is a newer name for Churg-Strauss syndrome. So these are the five important conditions in which you are going to be having granuloma formation in the blood vessels. Of course, nowadays you are going to be having an immunomodulatory drug which is given the name of rituximab. which can be given to a patient because it is an example of rituximab is a monoclonal antibody working against which type of molecule? It's going to be working as anti-CD20 drug. So that is what you need to remember so far as this kind of a condition is concerned, right? Just one question when we are talking about something which is going to be given the name of oculo-oral genital syndrome. So that is going to be associated with pathology test, and the name of the condition, of course, you are aware, is going to be called as Behçet's disease. Behçet's disease, right? So these are the things that have been asked in our exam as questions. So this is what is going to take care of our discussion of the vasculitis disorders, right? Of course, atherosclerosis and stuff is going to be easy. So I just kind of take that opportunity to kind of skip it. And now we're going to be having a discussion about endocrinology. So when I talk about endocrinology, of course, any day the topic can never be complete without having a discussion of thyroid. And of course, the next important topic that we have to have an idea is going to be adrenal gland, pheochromocytoma, big time exam questions that we need to have an idea. So when I'm talking about thyroid, you're going to be having a patient who's going to be having the presence of a thyroid dysfunction. And the patient is also going to be having the presence of an enlarged thyroid. There is going to be a presence of, Dr. Mitty, you're right. Granulomas are not found in the kidney per se. So when we're going to be talking about a patient who's going to be having hypothyroidism, reduced thyroid function, one of the commonest causes. One cause can be iodine deficiency, but iodine deficiency is only in the endemic areas like the Alps, like the Himalayan belt, right? But when we are talking about the autoimmune cause of development of hypothyroidism, as the books make a mention, that is going to be Hashimoto's thyroiditis. That is going to be Hashimoto's thyroiditis. So Hashimoto's thyroiditis is going to be an example of a condition which is an autoimmune disorder. Why? Because there is a problem at the level of HLA DR3, DR5, as a result of which the patients are going to be having development of T cell mediated attack and T cells, CD4 T cells, CD8 T cells attack. So now they are responsible for the formation of abnormal antibodies. So T cells attack the thyroid gland. Therefore, the T cells are going to be responsible for the formation of follicle-like structures. That is what is going to be given the name of a lymphoid follicle. And what we are also going to be getting in these patients is because the T cells are attacking, so you are going to be having cells. Thyroid cells will feel hurt. So heartless cells, ऐसे आप याद रख सकते हो, heartless cells, right? So T cells are going to hurt the cells of the thyroid because of which they will not be able to function properly. And the patients are going to be having an antibody which is going to be given the name of anti-TPO antibody. Why is anti-TPO antibody important? TPO is a very important enzyme which is required for iodification, for organification, for coupling. If TPO enzyme is not functioning properly, T3, T4 is not produced properly. So now the patients are going to be having hypothyroidism. That is an important thing to be kept in mind. Similar condition that you're going to be having is thyroid is going to be enlarged. Patient is going to be having features of hyperthyroidism. You are going to be having increased number of cells over here. So they are going to be having the presence of papillae formation over here. That is what is going to be seen as a feature of hyperthyroidism. And the condition is what is going to be given the name of Graves' disease. Graves' disease. What you need to remember over here in case of Graves' disease is number of cells are going to be higher, but these cells are going to be overactive as well. So they are going to be having the presence of not only a papillae-like projections, but what they are also going to be doing is these extra number of cells will start consuming colloid. Because they are consuming colloid, so there is going to be a whitish area, empty area that is going to be seen over here. And this empty area is what is going to be given the name of scalloping of colloid. So scalloping of colloid is what is going to be seen in patients who are going to be having over-functioning thyroid. That is what is going to be a classical finding that is going to be seen in these patients. Now, patients who are going to be having Graves' disease, not only are going to be having features of thyroid, I mean, that is what is known to you. They can be having features involving the skin. They can be having involvement of the eye as well. In the involvement of the eye and the skin, they are going to be having a development of what is given the name of dermopathy. And that is going to be associated with the term development of pretibial myxedema. Right? So you're going to be having those glucosaminoglycans, which are going to be retained in the subcutaneous tissue, retention of water. And that is what is going to result in pretibial myxedema. If I'm going to be talking about eye, patients are going to be having the development of proptosis. This can be unilateral or this can be bilateral proptosis. In fact, that is the reverse question asked in the exam. Adult individual having the presence of one-sided proptosis, you need to remember about Graves' disease. Adult individual having the presence of bilateral proptosis, you have to remember about Graves' disease. Adult patient who's going to be having pulsatile proptosis, you have to remember about keratodermatous fistula. When you're going to be talking about a child having the development of proptosis, you think in terms of a cancer like malignancy like neuroblastoma, right? So you just need to remember those facts. Of course, you're going to be having so many clinical signs that you're talking about over there. That is what is going to be remembered by the classical acronym that we're using, no Graves, right? No specs, no specs. So thyroid ophthalmopathy, no specs. The Stelvak sign, the Dalrymple sign, all those signs that we read about in ophthalmology, that is what is going to be remembered. Coming back to discussion over here, large number of cells, increase in the proliferation of the cells, consumption of the colloid by the thyroid follicular cells. This is what is going to be given the name of scalloping of the colloid, right? That's what you need to remember. If a patient is going to be having Graves' disease and the patient is also going to be having ocular involvement. Just a simple pharmacology point. Radioactive iodine is contraindicated. Radioactive iodine is going to contraindicate. Then we are going to be talking about the example of different types of thyroid cancers. Of course, the example of a thyroid cancer, which is going to be having orphan NEI nuclei. Do we have any important image? Okay, so we have that. Okay, we have a separate one. So we are going to be talking about a thyroid cancer, which is going to be having the presence of orphan NEI nuclei. What exactly is meant by the term orphan NEI nuclei is that you're going to be having a cancer, which is the hot favorite of your examiners these days, papillary thyroid cancer. Papillary thyroid cancer is the most common type of thyroid cancer, typically seen in case of young adults after a history of radiation exposure. Patients are going to be having the most common type of mutation, which is we have talked about already, BRAF gene mutation. BRAF gene mutation. The second mutation that can be seen in these patients can be red PTC gene mutation. Revising that perhaps for the final time, what are the other example of cancers which are going to be having BRAF gene mutation? Patients like LCH, patients like hairy cell leukemia, patients who are going to be suffering from conditions like melanoma, patients like having benign nevus, patients like papillary thyroid cancer. They're all going to be having the presence of a BRAF mutation. V600E is what we talked about. How do we detect this mutation? Single base primary extension test. That is what we talked about also. And yes, Anukriti, you're right. It is also seen in a patient who's going to be having pilocytic astrocytoma, especially the juvenile variant. Now, when we are going to be talking about the papillary thyroid cancer, it is not the papillary formation which is going to be characteristic. It is the nuclear features which is going to be characteristic of this particular condition. So nuclear findings are going to be presence of optically clear nuclear appearance over here, which is going to be given the name of orphan NEI nuclei. Patients are going to be having the presence of nuclear grooves. Patients are going to be having the presence of nuclear inclusions, which are given the name of pseudo inclusions. So that is what is being asked in the exam. Then we were asked a question in the exam on one of the variants of papillary thyroid cancer, which is going to be given the name of tall cell variant. The tall cell variant is what is important for us to remember because it is going to be locally aggressive, and therefore it is going to be causing more damage over here. However, what we need to remember over here is that the tall cell variant is going to be having a special association with the BRAF mutation, right? So this is going to be having relatively poor prognosis in comparison to the standard papillary thyroid cancer. Another thing that we need to remember over here is in context of thyroid cancer is going to be the type of thyroid cancer in which calcitonin is going to be increased, arising from the parafollicular cells associated with gain of function of RET mutation. Loss of RET mutation is a feature of loss of RET mutation. GI disorder, Hirschsprung disease, that is what we talked about. What is going to be the biopsy finding? Lack of the plexuses at the level of the Meissner's and the Urbex plexus. That is what we made a mention of. Over here, we are talking about the presence of gain of function of RET gene. And therefore, these patients are going to be having a cancer that is going to be given the name of medullary thyroid cancer. Medullary thyroid cancer. Now, whenever we're going to be making a mention of medullary thyroid cancer, of course, no discussion can ever be complete of medullary thyroid cancer. This can be an example of either a sporadic thing or it can be an example of a familial thing. Whenever we are going to be talking about the familial thing, obviously it is going to be having an association with something that is called by the name of MEN syndrome. What kind of MEN syndrome are we talking about over here? We discussed this yesterday, MEN2 syndrome. So of course, easy for us to recall. MEN1 is 3P, pituitary parathyroid pancreas. MEN2 is having two variants, 2A and 2B. 2A को तो 2 ही बोलते हैं, 2B को 3 बोलते हैं. So when we are going to be talking about a patient who's going to be having MEN2A or simply called as MEN2, the patients are going to be having the presence of medullary thyroid cancer. They are going to be having the presence of pheochromocytoma. In a patient who's going to be having MEN2A, this is also called by the name of Sippel syndrome. Remember, I told you the trick as well, no? Sippel के अंदर 2 P आते हैं. So one is going to be pheochromocytoma and the second one is going to be parathyroid hyperplasia. Remember this? Sippel के अंदर Sippel, P and P. So parathyroid is also affected and the patient is having pheochromocytoma. Medullary thyroid cancer तो है ही यहाँ पे. So MEN2 के अंदर, that is what you need to remember. The third one that you need to remember is MEN2B, which is also given the name of MEN3. MEN3 is going to be having medullary thyroid cancer, pheochromocytoma, and we are going to be having the presence of important findings, which are 3 M's. What are the 3 M's that we talk about in case of 3 से 3 M याद करने हैं? Marfanoid habitus, tall stature of the patient. M से remember you're going to be having mucosal neuromas, and M से remember the fact INI question megacolon. Sippel syndrome is MEN2 syndrome here. Sippel syndrome is MEN2. MEN2A का दूसरा नाम होता है सिप्पल सिंड्रोम. MEN2A का नाम होता है सिप्पल सिंड्रोम. MEN1 का नाम तो सबको पता है ना. वी आर कॉलिंग इट बाय द नेम ऑफ वर्मर सिंड्रोम. वर्मर सिंड्रोम था वो तो. MEN1 is वर्मर syndrome, 3P syndrome, pituitary parathyroid pancreas. Sippel syndrome is MEN2A syndrome. That is what is going to be associated. MEN2B के अंदर we are going to be having medullary thyroid cancer, pheochromocytoma and 3 M's, megacolon, marfanoid habitus and mucosal neuromas. MEN4 is just like MEN1. But difference is in the gene. In MEN4, you're going to be having the involvement of CDKNB. CDKNB cyclin dependent kinase का involvement होता है, right? That is what you need to remember. MEN5 is the one in which you're going to be having the presence of MAX gene. MAX. Maximum information. 1, 2, 3, 4, 5. सबसे बड़ा 5 maximum number. MAX gene. And that is what is going to be having gonadal involvement. That is going to be having bilateral pheochromocytoma. So that is something that we talked about earlier. तो यहाँ पे वापस आ रहे थे क्वेश्चन पे, कहाँ से कहानी शुरू करी थी? From the C cells or from the parafollicular cells, you are going to be having the origin of medullary thyroid cancer. Any patient having a positive family history of medullary thyroid cancer, these patients are advised to undergo prophylactic thyroidectomy, right? So we are going to be having doing a prophylactic thyroidectomy in these patients, and as some of you did make a mention of the fact, might have been told to you in surgery. In some patients, you're going to be doing it at an early stage, let us say 1 year, or in other patients, you're going to be doing it after a gap of like within 5 years. So I think 2B is more aggressive. So it will require the prophylactic thyroidectomy early, right? That's about it. Then we are going to be having the extra amount of calcitonin. This is what we already talked about. It is going to be associated with amyloid conversion, and this amyloid is going to be having an appearance which is going to be in the form of the pink appearance, right? So we got a question in the exam. I told you about 3 types of appearances that we are going to be getting with respect to something like the amyloid deposition. So amyloid deposition is going to be having the amyloid deposition seen in the heart is going to be seen as a feature of restrictive cardiomyopathy. Amyloid deposition is what was asked you in the exam in context of something like the thyroid gland. So that was a feature of medullary thyroid cancer. And of course, you got a standard question in the exam which was asking you about the appearance in context of congruent appearance. That is what is going to be associated with under polarized light, giving you an example of a apple green birefringence. So that's an example of apple green birefringence that we are talking about over here. That is to be remembered from the perspective of the exam, right? So thyroid extremely essential for the exams. Then we got a INI question. I don't know, just for the purpose of this being repeated in the exam. If you're going to be talking about the neurosecretory bodies, they can be seen in every tumor except. So they can be seen in medullary thyroid cancer. They can be seen in pituitary tumor like adenoma. They can be seen in paraganglioma as well, which is the pheochromocytoma, which is extra adrenal. But adrenal cortical tumors are not going to be having it. So adrenal medullary tumors have it, neurosecretory bodies. And we are going to be having adrenal cortical tumor, which is not going to be having. Yes, adrenal cortical tumor can be having the presence of oversecretion of a hormone like aldosterone. And if you're going to be having oversecretion of aldosterone, then you give a drug like aldosterone antagonist. Aldosterone antagonist drug, all of you are aware of, is spironolactone. So spironolactone antibodies can be, spironolactone bodies can be seen in a patient who's going to be having adrenal cortical tumor, right? That's what you need to remember. Somebody asked a question here, who miss ho gaya? I don't know what was the question. It just, वो disco drugs और ये सब तो आप कर ही लोगे ना. Now, this is an example of a tumor which was asked in the exam. It was asked as an INI question first, then it was asked in the exam as a INI question. So, NEET PG ka question hai, pheochromocytoma. The patients are going to be having the presence of something like PHE, as that is what we talk about. PHE, pheochromocytoma, palpitations, headache, and episodic hypertension. Patients are going to be MEN5 के अंदर इन्वॉल्वमेंट होती है गोनाडल यार ज्यादा. MEN5 के अंदर गोनाडल इन्वॉल्वमेंट ज्यादा होती है. MEN4 के अंदर MEN1 जैसा होता है बिल्कुल, लेकिन जीन डिफरेंट है. Then the patients are going to be having the presence of palpitations, headache, and episodic hypertension. There is more secretive production of catecholamines like adrenaline and noradrenaline. And the patients are going to be having the increased production of vinylyl mandelic acid that can be appearing in the urine sample of the patient. Patients having pheochromocytoma are going to be having or following a rule that is obsolete but still being asked in the exam. That is what is being called as a rule of 10. So it is going to be classically 10% of that is going to be seen in case of children, 10% of that is going to be bilateral, 10% is going to be malignant, right? 10% of them are going to be having germline mutations. Of course, some of them are now obscure because 25% of them have been shown to be having germline mutations. Majority of them are considered to be malignant unless proved otherwise. But what you need to remember over here is pheochromocytoma. What was the INI question? That this can be associated with something like, it is seen in case of adults. That is what you need to remember. It is benign. That is what was asked as a question in the exam. And it is going to be associated with something like MEN2A syndrome. It is associated with MEN2 syndrome. So it associated with both MEN2A as well as MEN2B. Any patient who is going to be having extra adrenal pheochromocytoma, that is what is going to be given the name of paraganglioma. I hope, and I am very happy to note that some of you who attended the mission class are able to recall it. Patients who are going to be having paraganglioma can be having an association with GIST as well. Paraganglioma plus GIST is what is going to be given the name of hereditary paraganglioma. That is because of succinate dehydrogenase complex problem. So that is what we had a discussion of earlier. Then what we are going to be talking about over here is the tumor cells are going to be responsible for the formation of a ball-like appearance. So ball of cells, and that is what is going to be given the name of Zelbalan, right? So Zelbalan is just ball of cells which are going to be having a ball-like pattern, Zelbalan, and then you are obviously going to be talking about the definitive treatment for this kind of a cancer being surgery. That is what was asked you as a question in the exam. So the question asked in the recent exams have been on Hashimoto's. The question asked in the exam have been on papillary thyroid cancer, both normal one as well as the tall cell variant, the BRAF mutation. Question asked in the exam has been on something like the pheochromocytoma. Question asked in the exam has been on something like the presence of the orphan nucleus, that is a hot favorite, medullary thyroid cancer. And the question asked in the exam has been on something like pheochromocytoma, and the advanced question can be on something like the hereditary paraganglioma, right? So GIST is an isolated question. GIST along as a component of Carnes is going to be question. GIST as a component of pheochromocytoma is also going to be question. Papillary carcinoma का सब lymphatic spread सकते हैं, lymphatic spread दोस्त. फॉलिकुलर का जो होता है, फॉलिकुलर का होता है हिमेटोजेनस स्प्रेड, और पैपिलरी का जो होता है लिम्फेटिक स्प्रेड. दैट इज व्हाई पेशेंट्स आर गोइंग टू बी यंग पेशेंट्स हैविंग अ हिस्ट्री ऑफ रेडिएशन एक्सपोजर, एंड दे कैन बी कमिंग टू यू बिकॉज ऑफ द प्रेजेंस ऑफ सर्वाइकल lymph node enlargement. The other thing that you need to remember regarding pheochromocytoma, I'm so happy somebody just recalled that. Yes, Dr. Nimra Abid. So recalling the fact that you can be having an association of pheochromocytoma with VHL syndrome. You are having an association of pheochromocytoma with NF1. That's of course important for you to be familiar with. And you're going to be having its association with other important syndromes like MEN2 syndromes. Not to forget about the succinate dehydrogenase complex. पैरागैंग्लियोमा का एसोसिएशन, पैरागैंग्लियोमा का मतलब होता है एक्स्ट्रा एड्रिनल फियोक्रोमोसाइटोमा. So extraadrenal pheochromocytoma can be seen in combination with GIST. That is called as hereditary paraganglioma syndrome. That's called as hereditary paraganglioma syndrome. Right? So that is the important thing that we just need to have an idea. Right? Why is extraadrenal pheochromocytoma or paraganglioma important? If I'm talking about only pheochromocytoma is responsible for secretion of both adrenaline as well as noradrenaline. But once we are talking about extraadrenal pheochromocytoma, that is what is associated with the involvement of the organs of Zuckerberg, right? So this is what is going to be responsible for secretion of only and only noradrenaline, right? So noradrenaline. So when it is not in adrenal, then it secretes Na. Na matlab noradrenaline. When it is not in the adrenal, then it secretes only N. That's how I remember it. And of course, you are going to be talking about examples of alpha plus beta blockers to be given in these patients, alpha first, then beta. And that is what is going to be causing the issue in the patients. Men के अंदर तो men 2 यार, men 2 अभी तो डिस्कशन किया ना सारा. कहाँ गया हमारा men? यहाँ पे men 2 के अंदर है ना pheochromocytoma. That's what we discussed. ठीक है, तो वो फिनॉक्सिब बेंजामीन और फेंटोलामीन वाला कंसेप्ट. सो दैट इज व्हाट दे आर गोइंग टू बी आस्किंग. सो आई रीइटरेट द फैक्ट थायराइड इज अ मस्ट नो एरिया. Of course, when we are going to be talking about thyroid, the question asked in the exam is on the FNAC of thyroid as well. So we follow what is given the name of the Batista criteria. Batista criteria. So you need to have 6 groups of cells. 6 groups of cells, and every group of cells should be having at least 10 cells each. 10 follicular cells each. 6 groups of cells, and there should be 10 groups of cells which should be present over. So that is what is called as an adequate FNAC. That is what you need to remember. So this was again what was asked you as a question in the exam. Of course, in FNAC, you need to remember the fact FNAC is not able to distinguish between follicular adenoma and follicular carcinoma. For distinguishing between follicular adenoma and follicular carcinoma, we have to perform a biopsy. And in case of follicular carcinoma, that is going to be showing you the presence of metastasis or involvement of blood vessels over here. In follicular adenoma, the biopsy is not going to be showing you the presence of involvement of the blood vessels. The capsule is going to remain intact. Capsule is going to remain intact. Another easy question that I just recalled is what was asked you is in the second prof vivas also. No example of a benign tumor which is non-encapsulated. Benign tumor ज़्यादातर encapsulated होते हैं. Malignant tumor spread कर जाते हैं capsule से बाहर. Which is an example of a benign tumor in which there is no capsule. Which benign tumor has no capsule? I can give you a hint. That is what you did in pediatrics. That's what you did in surgery as well. Spontaneous regression भी हो जाता है उसका. Hemangioma. It's a benign tumor but not having a capsule. Hemangioma. अरे डॉक्टर वेंकट बीसीसी जो होता है वो तो यार मेलिग्नेंट होता है. बेसल सेल कार्सिनोमा. बेसल सेल कार्सिनोमा तो मेलिग्नेंट होता है. वो तो मेलिग्नेंट है, नॉट हैविंग मेटास्टेसिस है. हेमांजियोमा बिनाइन ट्यूमर है. हेमांजियोमा बिनाइन ट्यूमर है. इट इज नॉट गोइंग टू बी हैविंग द प्रेजेंस ऑफ अ कैप्सूल. दैट्स व्हाट आई आस्क्ड. क्वेश्चन ध्यान से पढ़ लेना भाई. दिस इज व्हाट इज कॉल्ड एज रीडिंग बायस. जो हमें पता है, जो हमने सुन रखा है, दैट इज व्हाट वी हैव अ टेंडेंसी टू मार्क इन द एग्जाम. ठीक है, दैट्स व्हाट यू नीड टू बी फेमिलियर. देयर आर पीपल हु आर गोइंग टू बी इम्प्रेस्ड विद डॉक्टर मॉन्टगोमेरी. वाओ, मॉन्टगोमेरी अपने सीक्रेट शेयर कर दो. सो ही कुड बी द नेक्स्ट डॉक्टर कैवेलरी एज वेल. We had in the last batch, I mean, the people who appeared in the NEET PG 2024, we had somebody by the name Dr. Cavalry, right? So Dr. Cavalry and people like, Brahmjot, and there were other people, they used to have a very active recall, right? And that is the reason why these people performed really well in the exam as well. So I would give you the silver lining that people were having the same cranial capacity as what you are having. उनके यहाँ पे भी ये 1200 और 1400 ग्राम का ही था. ठीक है, और अभी आपके पास अच्छी चीज क्या है कि यू स्टिल हैव द टाइम टू रिवाइज, टाइम टू रिकॉल, टाइम टू एक्टिवली रीड व्हाट इज मिसिंग इन योर डिफरेंट सब्जेक्ट्स एज योर वीक पॉइंट. सो वर्क ऑन देम एंड डेफिनेटली यू आर गोइंग टू बी इंप्रूविंग. ठीक. Okay. So now what we're going to be having a discussion of is going to be the CNS tumors. Now with respect to CNS tumors, of course, you already know the fact that patients are going to be having the most common tumors are going to be asked in the exam. Of course, the all-time favorite of your examiners has to be a tumor which is going to be given the name of glioblastoma, as well as the other tumors which are asked in the exam are meningioma, and you are asked a question in the exam on all-time favorite schwannoma. Schwannoma. So that is a fact, but I don't think that we need to, invest too much of time in this, except for the fact I'll quickly recall for you that if I'm going to be talking about a tumor, glioblastoma is a term that is being used. Glioblastoma multiforme is not being used. So glioblastoma is an example of a malignant tumor that is going to be seen in case of adults. Most common malignant tumor that is going to be seen in case of adults is glioblastoma, an example of a tumor which is going to be arising in one cerebral hemisphere, crosses the midline, causes involvement of the other cerebral hemisphere. So it is going to be associated with, of course, an example of a term butterfly tumor. The tumor is going to be having an important finding. It is going to be having a zigzag pattern of necrosis. So there is going to be arrangement of the tumor cells which are going to be around this necrosis. So pseudo-palisading is what is going to be seen. This tumor is going to be highly aggressive. So it's an example of a serpentine necrosis with pseudo-palisading. Remember the fact, true palisading is a feature of schwannoma. True palisading is a feature of schwannoma. Pseudo-palisading is a feature of glioblastoma. Patients are going to be having the presence of this as a grade 4 tumor. This is also an example of a tumor in which you are going to be having the formation of oncometabolite. Why you are going to be having oncometabolite? Because of involvement of an enzyme that is given the name of IDH, isocitrate dehydrogenase, right? That is what we discussed yesterday. Can I inhibit this example of an enzyme? You can inhibit this particular tumor cell's growth by giving an example of an anti-cancer drug. An example of an anti-cancer drug which is going to be highly effective in case of brain tumors is going to be, somebody did make a mention of that fact, temozolomide. Temozolomide. टीमो मत याद रखना यार, टीमो से टीमो लॉल मत आंसर मार्क कर देना भगवान के लिए. टीमोजोलोमाइड पूरा नाम याद रख लेना, राइट? So these are the example of questions that are going to be asked in the exam. That's what you need to remember. Then we are going to be talking about oligodendroglioma, of course, an example of a tumor which is going to be associated with involvement of frontal lobe, and that too frontal lobe calcification. What you need to remember over here is oligodendroglioma is going to be having an important finding. This is a tumor cell. It is going to be having the presence of a nucleus. The nucleus is going to be having the presence of a perinuclear halo. Nucleus is going to be having the presence of a perinuclear halo. So this is going to be an example of again a tumor that is going to be seen in case of adults. It is going to be having the presence of other important findings. The most important finding is what you need to remember. एक तो उसका nature आपने याद रखना है, malignant in nature है. This is also going to be having in its pathogenesis involvement of oncometabolite formation. Remember, it is going to be having the presence of calcification. And remember the fact, one of the characteristic findings that you're going to be having for this tumor is going to be the presence of a fried egg appearance. So of course, I can always talk about the other additional findings that you're going to be having chicken wire capillaries over here. But let us just quickly recall example of other tumors. I believe we have done this earlier, but let's quickly recap. Example of tumors which are going to be having a fried egg appearance. Which tumor in case of kidney is going to be having this finding? Chromophobe cancer. Chromophobe cancer, which is an example of a bone marrow tumor which is going to be having this finding. It is seen in a patient who is going to be suffering from hairy cell leukemia. Hairy cell leukemia. So these are the other examples that you should be able to recall so far as your exam is concerned, right? द नेक्स्ट दैट, हाँ माइकोप्लाज्मा भी होता है, बट माइकोप्लाज्मा ट्यूमर नहीं होता ना, है ना? वो तो हमें याद रखना ना, पीपीएलओ बोलते हैं उसको हम, ईटोन्स एजेंट. देन वी आर टॉकिंग अबाउट अ ट्यूमर व्हिच इज गोइंग टू बी गिवन द नेम ऑफ मेनिंजियोमा. Tumor that is going to be given the name of meningioma. Now, importance of knowing what meningioma is, the fact it is an example of the most common benign tumor that is going to be seen in case of adults. Most common benign tumor that is going to be seen in case of adults. Meningioma is an example of a tumor which is going to be having an important property. It's going to be arising from cells of the arachnoid matter. Arachnoid matter से arise करता है. The other thing that you need to remember over here is going to be the finding that most of you are familiar with. The patients are going to be having features of increased intracranial tension. It is going to be having the expression of progesterone receptor. It is going to be having multiple subtypes, and it is going to be having the presence of concentric rings of calcium deposition. So concentric rings of calcium deposition, which is going to be given the name of Samoma bodies. Recall the fact. Recall the fact. Okay. I hope she's doing well, Dr. Nadia. Just convey my best wishes for her speedy recovery. I just wish to talk about the fact that when we are talking about meningioma, then we are going to be having a situation wherein the patients who are going to be having meningioma at times are going to be having an increased risk for development of the adenomatous polyposis as well. So medulloblastoma, meningioma are example of tumors which can be associated with adenomatous polyposis, and the syndrome I'm talking about is Turcot syndrome. Pretty good. So that is what you need to remember. So CNS tumors plus familial adenomatous polyposis is what is to be remembered as Turcot syndrome. That is what we made a mention of earlier as well. Of course, on the MRI, you're going to be having a radiological sign in association with meningioma. What is going to be given the name of dual tail sign? I have no idea about how does it look like, but the fact is it is going to be associated with meningioma. So benign progesterone receptor females, example of a tumor arising from the arachnoid matter having samoma bodies and is going to be associated with dual tail sign. These are the things that we need to remember over here, right? Then we're going to be talking about example of a tumor which is going to be given the name of pilocytic astrocytoma. Why we were talking about this is juvenile pilocytic astrocytoma is what you told me already, associated with BRAF mutation. This is an example of a tumor which is going to be having what kind of a nature? It is going to be a tumor which is going to be benign in nature. It's a tumor that is going to be seen in case of children. It's an example of a tumor pilocytic as we talk about that. So C for it is seen in case of children. It is going to be arising from cerebellum, long live cerebellum. Cerebellum is as benign as this kind of a tumor, so prognosis happens to be really good. And when we are going to be talking about the finding over here, it's going to be having the presence of a cystic mass, right? So you have a tumor which is going to be having a cystic mass over here. It is going to be having the presence of the pink colored fibers. Children love flowers. Chacha. So rose flower. So that is going to be given the name of Rosenthal fibers. Rosenthal fibers is what is going to be seen so far as this kind of a tumor is concerned, right? And it is going to be having the presence of a bipolar hair-like projections. So all in all, a benign tumor, and that is going to be having the presence of a good prognosis. So important fact to be remembered about this, of course, and the final finding associated with BRAF mutation. Then talking about a tumor which is going to be given the name of medulloblastoma. Medulloblastoma is an example of a tumor that is going to be seen in case of children. Unfortunately, an example of a malignant tumor, not arising from the medulla oblongata. That's an important thing to be kept in mind, arising from the cerebellum. It's an example of a malignant tumor, so it is going to be having metastasis. The typical feature of this kind of a metastasis is involvement of the cerebrospinal fluid, so it is associated with the term drop metastasis. Dural tail sign is for meningioma. Dural tail sign is for meningioma. Drop metastasis is associated with medulloblastoma. As and when we're going to be making a mention of the medulloblastoma, what is going to be seen over here is the tumor cells are going to be having a peculiar finding where there is formation of a flower-like pattern. Flower-like pattern is what is going to be given the name of rosettes. The kind of rosettes that are going to be seen over here is that in the center, you're going to be having a pink colored material. In the center, you're going to be having a pink colored material. So this is given the name of a pseudo rosette. Pseudo rosettes are going to be given the name of Homer Wright rosettes. Homer Wright rosettes. Right? That's what you need to remember. This medulloblastoma is also asked in the exam. Importantly, what was given to you as a question 2 years back is it is an example of tumors which are given in the category of SRBCs, small round blue tumor cells. So tumor cells over here are having a small size, just like a size of a small lymphocyte. And there is going to be presence of a nuclear material. Nucleus is far bigger in comparison to the cytoplasm. So that is the reason why you call it by the name of a small round blue tumor cell. Other example of tumors which are going to be having similar findings. One is medulloblastoma, another is retinoblastoma, another is Ewing sarcoma. Ewing sarcoma, medulloblastoma, retinoblastoma, Ewing sarcoma. Of course, we are talking about an adrenal gland tumor also over here as well. Adrenal gland tumor is going to be neuroblastoma. And how can we forget if I'm talking about pediatric tumor, Wilms tumor. So small round blue tumor cells, the actual reason is tumor cells are small. But remember, majority of these tumors are also going to be seen affecting children. So small size, small age of the children as well. So medulloblastoma is also a pediatric tumor. RB is also a tumor that can be seen in case of children. Ewing sarcoma is also a pediatric tumor. Neuroblastoma is a pediatric tumor. Wilms tumor is a pediatric tumor. Out of all of them, what makes them distinguished over here is RB is an example. Retinoblastoma is an example of a tumor in which you are going to be having the presence of true rosettes as well as false rosettes. True rosettes, which are going to be given the name of, as all of you are aware of, you have to flex your muscles and win the game. Flex your muscles, win the game. Flexner Wintersteiner rosettes. Flex your muscles and win the game. Flex these muscles, the brain muscles that you have, and Flexner Wintersteiner rosettes. And when we are going to be talking about the pseudo rosettes, they are going to be given the name of Homer rosettes. So those are the things that are going to be commonly asked in the exam with regards to medulloblastoma. That's all I can recall as of now. And talking about the often asked question in the exam, that is on something which is going to be given the name of schwannoma. An example of a tumor which is going to be having a finding. It is going to be associated with arising from the 8th cranial nerve. So at times it is going to be given the name of an acoustic neuroma. Especially it is going to be arising from the inferior vestibular nuclei. It is going to be having an association that it can be bilateral. If a patient is going to be having NF2 gene mutation, NF2 of course is going to be associated with tumor suppressor action, and the name of the protein that is involved in NF2 is going to be given the name of Merlin. What's the protein that is involved in NF1? NF1 में कौन सा होता है? Neurofibromine. Neurofibromine is NF1. So that controls the activity at the level of cell replication. NF2 is called as Merlin. And what you need to remember over here is NF1 में जो neurofibromine होता है, that is under the influence of 17q, number of alphabets. That's the rule that we need to remember about. NF2 का साथ में rule जो होता है, that is 2 alphabets and numerical 2 and 2, 22. 22q is the location. This is what is going to be associated with the fact that the patients are going to be having hypercellular and hypocellular area. So hypercellular area is what is given the name of Antony A area. Antony A area, that is what you can see. A for आजा, आजा, आजा. Tumor cells को आप बुला रहे हो, आजा. B for भाग जा. Hypocellular area. So Antony B area is hypocellular. When you are looking at the Antony A area, which is having more number of cells, then this is going to be having a true palisading. This is going to be having a true palisading. And that is what is going to be associated with the tumor cells arranging themselves in a disciplined fashion. Tumor cells arranging themselves in a disciplined fashion. When they arrange themselves in a disciplined fashion, you are going to be having nuclear free zones in between, and the nuclear free zones are going to be given the name of Verrucke bodies. Nuclear free zones are going to be given the name of Verrucke bodies. So you're getting got a question in the exam that majority of these tumors are going to be benign in nature. They can be bilateral only when there is a Merlin mutation or NF2 mutation. There are going to be presence of hypercellular area, or they could be example of hypocellular areas, which is given the name of Antony B. So these are the 5 or 6 questions that are repeatedly asked in the exam. In fact, that was also an INA question asked in the November 24 exam as well. That is what we need to remember. Of course, I'm going to be talking about, as some of you did make a mention of, that is what is going to be given the name of Miss Me. Miss Me over here is not missing me tomorrow. We are going to be having an interaction. That is what you need to remember. It is just a multiple inherited schwannoma and meningioma. That's what we need to be familiar with, right? So, of course, that is what is going to be important from the exams perspective. And you are having that radiological science, some ice cream cone or something, no? So that is what a lot of you, I mean, you people have a better idea, right? Perhaps that is the reason why you are going to be missing this kind of a tumor. We all love ice creams. Of course, do eat ice creams only when they're true ice creams. Don't eat frozen desserts. Not criticizing, but then all our childhood, we were fooled by eating quality. They called it as an ice cream. It was not an ice cream. It was just dalda. It was a frozen dessert. Pretty bad, no? Anyways, stay away from the palm oil because palm oil is going to be causing a lot of money loss from your palms. All trans fats, all getting deposited in the liver, causing fatty liver disease, metabolic syndrome, diabetes mellitus, dyslipidemia. Yeah. The only kind of true ice cream that you are aware of is the one that mama makes, right? That's what you need to remember. हाँ जी, मिस ब्रांडिंग हो गई इसके अंदर, बिल्कुल ठीक कह रहे हैं। भूल जाओ भाई, पीनट के अंदर कौन सा बटर होता है भाई? कोई बटर नहीं होता। बटर में पीनट्स नहीं होते, पीनट में बटर नहीं होता। पागल बना रही है पूरी दुनिया आपको, ठीक है? सो आपको ध्यान रखना है, अपने आप को खुद बचाना है। नेचुरल्स में भी पता नहीं कितना नेचुरल है यार, उनको डोंट गो बाय द नेम, डोंट गो बाय द नेम। इट्स ऑलमोस्ट लाइक सेइंग इट्स अ टोमेटो केचप ना, इट इज गोइंग टू बी हैविंग ओनली 5% टोमेटो। सेम चीज है यार, वो पूरा भगोना मिस ब्रांडिंग है। कैश्यू नट्स के अंदर वो पढ़ा ही है आपने, यू सीन दैट वीडियो ना? सो दैट इज ओनली 1%, मतलब 0.5% नट्स डाल रखे हैं उसमें। It's all sugar. In fact, for KFC also, in case somebody of you is happens to be non-vegetarian, they do a coating over there for the wings, what they call as non-vegetarian food over there. That instant sugar spike is going to causing you an addiction, not the taste, right? Okay, so stay away from sugar here. Be sweet without sugar, right? God has given you so many things to be kind and be sweet. Don't be sweet dependent upon that. Chalo. We'll get emotional about this. Yeah, this is a very touchy topic because all of us have collectively been befooled by the stupid people, by the people who are making a lot of money on this. ठीक है? That's what it remember. मोस्ट फॉर पीजी का फुल फॉर्म? अच्छा, मोस्ट फॉर पीजी का फुल फॉर्म ये तो यार मेनिंजियोमा, ओवेरियन सीरस सिस्टेडिनोमा, papillary thyroid cancer, papillary cancer that is going to be seen in the kidney, prolactinoma and glucagonoma. ठीक. So eat your desi ghee, yeah, that is the best thing that is to be taken. No refined oils, absolutely. The only oil that you can be taking if you happen to be in North India, Central India is mustard oil. If you are in South India, take coconut oil. Right? That's what you need to remember. All is crap. I don't even know. I mean, you have seen that video going viral of people eating those chicken momos, na? And the chicken was not chicken; it was actually dog meat. That too, stray dogs. You seen that video going viral in Mohali and Punjab? So God bless us. And otherwise, also, if you ever see, right? If you ever see the way the things are being made, you will never have it. The same oil is being heated at least 10 times, by the local halwai. So that is going to be full of trans fats. And then those trans fats are going to play havoc with your coronary arteries. Right? And then people will wonder why somebody collapsed at the age of 40, 50 or, earlier. So just going for the classical standard cheese, which was the mustard oil and the desi ghee stuff. All right. I think we tried as much as level best to improve the things, doc. Right? No, people in the south can have mustard oil. My point was regional oils are going to be the best, natural oils. So coconut oil is pretty good, right? हाँ. तो जिए कैसे और बोले तो बोले क्या, खाए तो खाए क्या, एग्जैक्टली वही सिचुएशन हो चुका है यार. ईट एज मच रॉ मटेरियल एज पॉसिबल, राइट? सो पीपल हु आर अब्रॉड, आई मीन दे अंडरस्टैंड द फैक्ट ना, स्मूदीज पीते हैं वो इसीलिए. ऑलिव भाई, सब सब बेकार है भाई. राइस ब्रान ऑयल, ऑलिव ऑयल, सब वो मार्केटिंग गिमिक है भाई. मेरी शर्ट पे पिकाचू नहीं बना यार, ये वो बर्बरी का वो डिजाइन है भाई. वेरुके बॉडी इज एन एग्जांपल ऑफ अ न्यूक्लियर फ्री जोन. न्यूक्लियर फ्री जोन, सो दिस इज अ न्यूक्लियर फ्री जोन दैट वी कुड बी हैविंग. पिकाचू पिकाचू ज्यादा मत करो यार, फिर वो आ जाएगी. मैं क्या दुकान से कैसे ही बंद कराऊंगा यार. बिस्कुट मत खाना, पागल आदमी. बिस्कुट चाय भी हो, बिस्कुट खाओ. चाय, चाय बिस्कुट इज नेक्स्ट लेवल एडिक्शन भाई. उसका डिस्कशन करेंगे किसी दिन. नॉन एकेडमी डिस्कशन है ये सारा का सारा. ठीक है. Chai is the original form of chai which came from China actually has to be consumed only with hot water. So you have to first pour the leaves and then you have to pour the hot water, right? That's what you need to remember. So it has to be taken without sugar, without milk. That is how it is going to be effective. The kind of tea that you expect to get in 500 rupees kg is, talk to any guy who happens to be in Darjeeling or any of the tea growing areas here. The minimum level of tea which is going to be considered as a relatively good quality of tea is 5,000 rupees kg. Right? 5,000 rupees kg. So you cannot have a 300-400 रुपए वाली चीज. ठीक है. तो इसलिए चाय छोड़ दो भाई. बिस्कुट तो पता ही है यार, पूरा का पूरा कंसंट्रेटेड शुगर एंड ऑल. चलो, सब बेवफा है भाई. माँ बाप को छोड़ के सब बेवफा है. सिर्फ सोना बेवफा नहीं है, चाय बेवफा है, बिस्कुट बेवफा है, कॉफी बेवफा है, सब कुछ है. ठीक है, चलो आगे बढ़ जाते हैं. नाउ व्हाट वी गोट बी टॉकिंग अबाउट ओवर हियर इज गोट बी ब्रेक. कॉफी का अलग कहानी है भाई. पूरा अमेज़न जंगल खाली कर रहे हैं वो पागलों की तरह. छोड़ दो उसे. सो वी गोट बी हैविंग, हाँ, सोनम बेवफा है तो याद हो गया ना. वो बेवफा ड्रग की दवाई तो याद है, साइडल ड्रग्स याद करा दो. जितनी भी साइडल ड्रग्स हैं वो याद करा दो बेवफा से. हाँ, बीटा लैक्टम. उसके बाद वैंकोमाइसिन. हाँ, उसके बाद, अरे वैंकूवर नहीं है, वैंकोमाइसिन है यार. वैंकूवर तो जगह है कनाडा. और उसके बाद फ्लोरोक्विनोन्स और अमाइनोग्लाइकोसाइड्स. हाँ, so these are all considered as example of sidal drugs. They're all example of sidal drugs. That's what you need to remember. Which of these drugs are going to be having? Which of these drugs are going to be having selectively the action on the gram-negative bacilli? They're having a selective action on the gram-negative bacilli. Aminoglycosides. Aminoglycosides. Which aminoglycoside is going to be having the least resistance? Which aminoglycoside is having the least resistance? इसीलिए तुम उसको अस्पताल के अंदर यूज करते हो सबसे ज्यादा भाई. अमीकासिन. एजिथ्रोमाइसिन ही होती है. अनुकृति कैसी बातें करिए. एजिथ्रोमाइसिन तो मैक्रोलाइड है ना, वो तो 50 पे काम करेगी. अमीनोग्लाइकोसाइड की बात हो रही है. फ्रीजिंग ऑफ इनिशिएशन, मिसरीडिंग ऑफ एमआरएनए. ठीक है, अमीकासिन की बात कर रहे हैं. बाय एट 30, सेल एट 50. सब मारवाड़ी बन जाओ कमकता हूँ. चलो वापस आ जाओ. व्हेन वी आर टॉकिंग अबाउट अ कंडीशन लाइक ब्रेस्ट टिश्यू यार, इसमें तो ज्यादा मतलब एज सच इंडिविजुअली नहीं है, बट दिस इज व्हाट हैज बीन गिवन यू इन नोट्स. सो नहीं, दिमाग नहीं बंद हो गया यार. वो मतलब इतनी भारी गलती मत कर देना. मेरा कहने का मतलब है छोटी मोटी गलती अलाउड है. ट्यूमर्स के अंदर कर दो KI67 को ऊपर नीचे कर दो तो ठीक बात है, बट ऐसे मत कर देना कि क्वेश्चन उसके ऊपर चल रहा है फ्लोरोक्विनोन्स पे और तुम मैनिपुलाक्वासाइड आंसर कर रहे हो या अदर वे अराउंड। ठीक है, कौन सा फ्लोरोक्विनोन होता है जिससे डिसग्लाइसीमिया हो जाता है? विच फ्लोरोक्विनोन इज रिस्पॉन्सिबल फॉर कॉजिंग डिसग्लाइसीमिया? जी से ग्लूकोज डिसग्लाइसीमिया मतलब ग्लूकोज का प्रॉब्लम, जी से ग्लूकोज, जी से गति फ्लॉक्सासिन बैन हुई थी ना इसीलिए, क्या चीज फ्लॉक्सासिन। ठीक है। टू मैनी CD मार्कर्स भाई, ऐसा कर एक टेबल याद कर ले, उस टेबल के अंदर सबसे पहले तो वो वाले याद करना जो एग्जाम के अंदर आ चुके हैं, ताकि अगर उसमें से रिपीट क्वेश्चन हो जाए जो बाकी सबका ठीक होगा वो आपका भी ठीक होना चाहिए, राइट। एंड वेन एवर यू गोना बी टॉकिंग अबाउट द रिमेनिंग वंस, वो आप ऐसा मानना कि वो एड ऑन चीज है, वो बोनस है। ठीक है, वो वाली चीज आपको ध्यान रखनी है। ओ माय गॉड, रेस्पिरेटरी फ्लोरोक्विनोन्स, बिल्कुल ठीक कह रहा है, सॉरी डॉक्टर हियर्सरी, ओ माय गॉड, हाँ। PMT निमोनिक तुमने सारे याद रखे हैं। ये हिमांशु भाई बहुत मस्त काम कर रहे हो, ओ माय गॉड, ये दवाई लीवो। ठीक है। ठीक है, निमोनिक जो याद कर रखे हैं उसका एक्सपेंशन याद कर लेना भाई। चलो इन्फ्लामेटरी कंडीशन की बात करते हैं, चलो तो ऐसे कह रहे हो घुमाने लेके चल रहे हो कमक, तो जल्दी से रिजल्ट लेके आना, उसके बाद कर लेना। सात्विक डावी पंजाबी, यू आर टेलिंग मी यू आर अ पंजाबी, आई एम अ पंजाबी, हु इज अ पंजाबी? Doesn't make a difference. We'll all do bale bale once you get a good result. Okay, coming back to our discussion over here, we are going to be having breast as an example of a modified apocrine gland, and the functional unit of the breast is going to be TDLE, right? All Punjabi, don't worry. So when we're going to be talking about the presence of a patient who's going to be having the presence of a greenish discharge, that's going to be associated with ectasia of the mammary duct. So mammary duct ectasia is what is going to be associated with the discoloration of the patient is going to be presence of a greenish discharge. Of course, we can be talking about a bloody discharge, which is going to be seen in a patient who's going to be having a papilloma. The questions asked in the exam have been on tumors of late. We just got a question about 3 years back on the condition which is going to be given the name of periductal mastitis. And why we said it was a question on periductal mastitis or Zuska's disease was the patient was a smoker who was having squamous metaplasia, because of which the patients were having the presence of redness and pain in the breast tissue, and they were also having the presence of a nipple retraction. Then what was we got as a question in the exam was, I just missed out on the fact, but before I talk about this, two questions that you need to remember over here. One is going to be a question asking you about the commonest tumor that is going to be seen in the breast tissue, breast mouse, or what is given the name of fibroadenoma. Fibroadenoma is also linked with an example of a drug that you need to remember. Fibroadenoma is also associated with an example of a drug that is given the name of cyclosporin. So cyclosporin, if it is given to an individual, it can be responsible for causing bilateral and multiple fibroadenomas. That is what you need to remember. The second was an example of a breast tissue tumor, which is going to be making the breast very bulky, and it is going to be having the presence of a leaf-like growth pattern on the microscopic or histology. So whenever you're going to be talking about a leaf-like pattern, that is given the name of Phyllodes tumor. Phyllodes tumor. What you need to remember, of course, as an example of an extension of a question is Phyllodes tumor is not going to be having the lymphatic spread. So they'll have to ask you this kind of a question that in Phyllodes tumor, lymphatic dissection is going to be contraindicated. Axillary lymph node dissection is not to be done in a patient having Phyllodes tumor. Regarding Phyllodes tumor, the other important thing that was asked in the exam was, apart from this being causing, in case of a patient who's going to be like 50 years of age, having a very bulky breast, this has been shown to be having a high chance of development of recurrence. Phyllodes has been associated with high chance of development of recurrence for the simple reason that if I'm going to be excising this tumor, there is a possibility that some part of the tumor may still remain in the patients, even though the surgeons will take care of the best probability that such a thing is not being seen, but then some of the patients can be having the presence of a recurrence so far as a Phyllodes tumor is concerned, right? So that is the other thing that they ask in the exam. Then all-time favorite of your examiners is going to be a question on the CA breast. ड्रग कॉजिंग फाइब्रोडिनोमा साइक्लोस्पोरिन, बाइलेटरल फाइब्रोडिनोमा साइक्लोस्पोरिन से होते हैं, साइक्लोस्पोरिन। ठीक है, साइक्लोस्पोरिन तो याद है ना, इम्यूनोसप्रेसेंट ड्रग, right? Then we are going to be talking about an example of a question that is asked in the exam with regards to CA breast. Of course, the risk factors are what are already known to you. We are going to be talking about a situation where the patients are going to be having the presence of the molecular classification of breast cancer. When we're talking about the molecular classification of breast cancer, that is dependent upon the gene expression profiling. Of course, we are, as the books maker mentioned, that there is going to be 4 important subtypes, all of which have been asked in the exam already. Specifically, the examiners are very much interested in knowing about the luminal A, which is a situation where the patient is going to be an elderly female. If you do the examination of this patient, she's going to be having the presence of overexpression of ER and PR, but she's not going to be having the expression of the HER2 new receptor. The good point about having a luminal A is that it is going to be having low Ki value. So the rate of mitosis is going to be relatively less, and therefore the prognosis happens to be really amazing, really good. In contrast, if I'm talking about a patient who's going to be having luminal B cancer, it is very similar to luminal A. Some patients having luminal B can be having a small expression of HER2, but the important differentiation point is high rate of mitotic activity. So therefore the prognosis happens to be poor. Now, when I'm talking about these receptors, ER and PR, I hope most of you have an idea. ER and PR receptors are example of nuclear receptors. They are example of nuclear receptors. But when I'm going to be talking about HER2 new is called by the name of ERB-B2. ERB-B2 is a subtype of epidermal growth factor receptor. Epidermal growth factor receptor is present on the membrane. It is present on the membrane. So how do I see for the presence of the nuclear receptor or the membranous receptors? You have to do the staining. Now, how would you do the staining? The staining is going to be done with the help of what is given the name of IHC. So you are going to be doing a staining, and that is what is going to be associated with IHC. So you do a scoring pattern. If nothing is visible, you call it by the name of a 0, or you call it by the name of 1. If you are going to be having a score of 2 or 3, then you are going to be very sure that there is an overexpression. But if you are going to be talking about having a score of 2, then you are in a indecisive state, equivocal state. So 1 means it is not expressed sufficiently. 2 and 3 means it is expressed sufficiently. 3 means it is going to be expressed sufficiently. And once you're talking about 2, then what you're going to be going in for is a further investigation, which is going to be given the name of FISH. So IHC score of 2, I repeat that, IHC score of 2 is what is called as an equivocal score. That is a time when you're going in for something like FISH. ARB B1 था यार lung cancer में MSD. ARB B2 is what is going to be talking about breast cancer. Right? ARB B1 पे तो कथा कहानी पढ़ ली ना हमने सारी, जेफिटिनेब, erlotinib वाली, और साथ में क्रिजोटिनिब पढ़ी थी LK में. Right? What we are then going to be talking about over here is going to be the fact that when you're going to be doing a staining, a very important, the way of looking at the stain is going to be with the help of, if I have an image, okay, this is the kind of staining that I'm talking about. So once you're going to be talking about the staining, you're going to be getting a brown color over here. And this brown color is what is going to be associated with the presence of a stain, that is a chemical that is going to be given the name of diaminobenzidine. So this is what is going to be given the name of a chromogen. Chromogen matlab aisa chemical which is going to be giving you a color. So diaminobenzidine is what is going to be giving a color, that is what is going to be associated with the brown color. Diaminobenzidine, right? So once you're going to be having a score which is going to be like 3, it is a sure positive. Once you are going to be having a score of 0 or 1, that means it is not there. Score of 2 means equivocal. And for that, you have to go in for something like FISH, in which you are going to be showing the presence of an overexpression of a particular gene. Next thing that we have to have an idea over here is going to be a patient who's going to be having the presence of HER2 enriched cancer. HER2 enriched cancer, unfortunately, is associated with P53 gene mutation. These patients are younger females and they are going to be having overexpression of HER2. Now, because of its aggressive nature, this cancer is going to be having a poorer prognosis. And the only important thing that you have to remember over here is, if my patient is going to be having a specific receptor being present, then the drugs can be given for the treatment of such patients. For example, if my patient is having ER expression positive, then I can give a drug like tamoxifen, I can give a drug like anastrozole. Right? What is the mechanism of action of anastrozole? Anastrozole, jaldi se bata do, wo to aasan hai. It's an example of anastrozole, letrozole, example of aromatase inhibitors, right? If I'm going to be talking about HER2 enrichment, then you can be treating it with the help of drugs like trastuzumab and pertuzumab. The problem that we have with hertuzumab is going to be the fact that they are example of drugs which are going to be responsible for cardiotoxicity, right? That is what you need to remember. And of course, we are going to be having, हाँ पर तू नहीं मानेगा रोहन, बिल्कुल ठीक बात है मेरे दोस्त, पर एग्जाम में मान जाना ताकि एग्जाम का क्वेश्चन ठीक कर दो. Then we are going to be having a term that is going to be called as basal. Basal is what is also called by the name of TNBC, and this is what is going to be associated with BRCA1. Why BRCA1 is important? Because this is an important reason for development of breast cancer in the familial category. अच्छा, तो आप ये पैब्लोसिक्लिब और रिक्लोसिक्लिब की बात कर रहे हो. सिक्लिब जो ड्रग्स होती हैं वो साइक्लिन इनहिबिटर्स होती हैं. दे आर गोइंग टू बी गिवन फॉर ब्रेस्ट कैंसर. ऑफ कोर्स वी आर गोइंग टू बी हैविंग अदर ड्रग्स एज वेल. So when we are talking about the TNBC, that is what is called as the basal subtype of cancer, and that is what is going to be having certain special variants, usually which are not going to be asked in the exam. So nowadays we simply go in for the molecular classification, because based upon the gene expression profiling, you are going to be starting the targeted anti-cancer drugs for these patients. Usually the patients are going to be treated with the help of drugs which are going to be in a combination of what is going to be given the name of the CAF regime. If I'm talking about the CAF regime in pharmacology, what is CAF? What is CAF? C for cyclophosphamide. Side effect is hemorrhagic cystitis, so that has to be taken care of. A for adriamycin, cardiotoxic drug. F for, you know the answer. F is for 5-FU. So doctors are in a situation wherein if somebody calls them as FU, then also they are happy because they say it is 5-fluorouracil. 5-fluorouracil is an example of a drug whose activity increases because of presence of leucovorin. Whose activity increases in the presence of leucovorin. That's what you need to remember. So leucovorin is given for with methotrexate so as to decrease the toxicity. Adriamycin, yeah, adriamycin. Cyclophosphamide, adriamycin, 5-fluorouracil, CAF regime. Targeted drugs can be drugs like tamoxifen, or you can be giving a drug like trastuzumab, or you can be giving a drug like pertuzumab, or you can be giving a drug like palbociclib. Palbociclib. Cyclib matlab cyclin inhibitor. Cyclin inhibitor. That is what you need to remember. So cyclin inhibitors are going to be given. That is what you need to remember. Palbociclib is what is going to be given in a patient who is going to be having breast cancer. Then we are having the presence of tyrosine kinase inhibitors also, which somebody did make a mention of. That is what is going to be given the name of a drug like lapata wali drug, lapatinib. नहीं, ए एडिनोसिन नहीं होती यार, एड्रियामाइसिन भाई। एडिनोसिन तो अलग हो गई ना। एडिनोसिन तो दवाई अलग हो गई। एडिनोसिन तो आप देते हो फॉर द ट्रीटमेंट ऑफ एरिथमिया। सेंट्रल लाइन के अंदर देते हो ना एडिनोसिन फॉर द ड्रग ऑफ चॉइस फॉर द ट्रीटमेंट ऑफ पैरोक्सिस्मल सुप्रावेंट्रिकुलर टेकिकार्डिया, साइड इफेक्ट ब्रोंकोस्पैज्म। ठीक है, सो एडिनोसिन को यहाँ पे कंफ्यूज नहीं करना यार, दिस इज एड्रियामाइसिन। कहाँ से मुझे कहाँ ले गए तुम? यस, रैपिड पुश। जादू करती है जादू, पीएसवीटी गायब हो जाता है उसमें। अब तुमने पीएसवीटी गायब कर दिया और तुमने मेरे दिमाग से क्वेश्चन गायब कर दिया, तो मुझे तुम्हें शेयर करना था। फिर तुम बाद में कहोगे कि सब कुछ नहीं पढ़ाया। एडिनोसिन, एडिनोसिन, एडिनोसिन पे क्यों ले आया यार फिश? और हमें ये वाला पॉइंट याद रखना था। हम्म, 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 और उन्होंने क्या पूछा था हमसे एग्जाम के अंदर? अच्छा, एक क्वेश्चन आया था हमारे एग्जाम के अंदर जिसमें थोड़ा सा कंट्रोवर्सी था विद रिस्पेक्ट टू द नेचर ऑफ द मार्कर दैट वी आर गोइंग टू बी हैविंग। विद रिस्पेक्ट टू द नेचर ऑफ द मार्कर्स, ईआर का क्वेश्चन आया था जहाँ पे उसने पूछा था डायग्नोस्टिक मार्कर है, प्रोग्नोस्टिक मार्कर है, डायग्नोस्टिक मार्कर है, प्रोग्नोस्टिक मार्कर है, सरोगेट मार्कर है। मैंने इसका आंसर आपको समझाया था, इट इज गोइंग टू बी एन एग्जांपल ऑफ अ प्रिडिक्टिव मार्कर। डायग्नोसिस के लिए तो आप इसको सोलो में यूज नहीं कर रहे बिकॉज आप अदर टेस्ट आर आल्सो बीइंग डन। व्हाई इज इट नॉट गोइंग टू बी एन एग्जांपल ऑफ अ it is not an example of a prognostic marker is because there are other prognostic markers also. Why is it an example of a predictive marker? Because it can predict the response to anti ER drugs, right? लपेटे ने तो पढ़ाई दी थी ना यार आपको। तो आपके एग्जाम में जो क्वेश्चंस आए दे वर ऑन जीन एक्सप्रेशन प्रोफाइलिंग फर्स्ट। द क्वेश्चन वाज आस्क्ड ऑन द क्लासिफिकेशन, मॉलिक्यूलर क्लासिफिकेशन। क्वेश्चन वाज आस्क्ड ऑन IHC scoring, and then what is to be done fish. Question was asked in the exam with regards to the ERB-B2, that is HER2 new, ERB-B1, that is lung cancer. Then the question asked in the exam was about diaminobenzidine. Then question asked in the exam was about luminal A and luminal B. Then the question asked in the exam was TNBC, basal-like. Then the question asked in the exam was on the anti-cancer drugs which are going to be given to the patients. And then next question asked in the exam was with regards to the role of ER, which is an example of a predictive marker. Okay. And then this was a question asked on the exam, which is obviously going to be an easy one, which I hope that most of you will be getting right. So this is going to be ER-PR positive, HER2 negative, and the low rate of activity. Right? If I'm talking about option A is representative of luminal B type of cancer. Luminal B type of cancer. Right? Option A is going to be associated with luminal B type of cancer. HER2 में तो आपका ओवर एक्सप्रेशन होता है, आपको पता ही है, और TNBC में all the three are going to be negative. So I believe that is what is required so far as the breast cancer is concerned. And now just making a word about अच्छा, एक चीज हमने याद रखी थी जो, अच्छा sorry, this is TNBC यार, sorry, this is TNBC, this one is luminal, this one is going to be luminal B. First one is all three negative, so that is going to be TNBC, and the D option is going to be luminal B, right? That is what you are talking. देन टॉकिंग अबाउट द लीवर, लीवर के ऊपर जो क्वेश्चंस हैं एग्जाम के अंदर, वो बहुत ऐसे ज्यादा वाले तो नहीं है, बट लीवर के अंदर जो क्वेश्चंस आते हैं एग्जाम के अंदर, दिस वाज ऑन अल्फा 1 एंटीट्रिप्सिन डेफिशिएंसी, सेकंड क्वेश्चन वाज ऑन विल्सन्स, थर्ड वाज ऑन हीमोक्रोमेटोसिस. But just for the sake of completion, we can just talk about the fact that there can be causes of jaundice. So I hope verbally we can just revise the fact that if I'm going to be talking about two types of syndromes, one which is going to be given the name of Gilbert syndrome, the other one that we talk about is Crigler-Najjar syndrome. So these are going to be the ones which are going to be having the presence of increased unconjugated bilirubin. Whereas when we are talking about Dubin-Johnson syndrome, Dubin-Johnson syndrome, or I'm talking about Rotor syndrome. Dubin-Johnson syndrome or Rotor syndrome, these are the ones which are going to be having the presence of conjugated bilirubin, right? So that is what you need to remember. Distinguishing factor between these two, Crigler-Najjar and Gilbert syndrome, is Crigler-Najjar is going to be a problem that is going to be seen in case of children or neonates. And Gilbert syndrome is going to be a problem that is going to be seen in case of adults. Dubin-Johnson is the one which is going to be having dark pigmented liver, DJ, darkly pigmented liver plus jaundice. Rotor syndrome is only going to be jaundice. The liver is going to be having normal pigmentation, right? Then we are talking about example of conditions. That is what we made a mention of earlier, primary sclerosing cholangitis, in which there is an antibody called as p-ANCA. The patients are going to be having involvement of both the types of ducts, intrahepatic as well as extrahepatic ducts. And yes, it is going to be having an association with ulcerative colitis. Typically, what you're going to be seeing in patients having primary sclerosing cholangitis is smarter sex is going to be males. Young males obviously are going to be smarter. So this patient is going to be a 30-year-old male. Smarter individuals, 30-year-old male. And males, when they are going to be becoming too smart, then they are going to get married. When they're going to get married, they are going to be going to the vegetable market. They're going to bring onions. So onion skin appearance, right? But if I'm going to be talking about the beautiful sex happens to be females. The most beautiful female that you will ever encounter in your life, the one who's going to love you most, is going to be a mother, Amma. And therefore, 50-year-old female who's going to be having the presence of anti-mitochondrial antibody. She will love you from inside. So intrahepatic ducts are what are going to be affected in these patients. And yes, it is going to be associated with the presence of a granulomatous inflammation, which is given the name of florid duct lesion. So what has been asked in the exam has been two questions. Question number one, I repeat, is primary biliary cholangitis is associated with anti-mitochondrial antibody. I hope you can remember and revise the fact. What is the antibody that you see in a patient who's going to be suffering from autoimmune myositis? Autoimmune myositis. Autoimmune myositis. So Jovan is a shorter name, but what is the technical name that was asked in the exam? Antihistidyl aminoacyl tRNA synthetase. INICT में तो करना है ना हमें टारगेट, हम कोशिश तो करेंगे. Antihistidyl tRNA synthetase enzyme. If a patient is going to be having the presence of scleroderma, and this patient is going to be having the presence of which antibody is indicative of development of acute onset of renal failure? Which onset of renal failure? ठीक है, RNA polymerase 3 antibody, right? So that is what you need to remember. So this is an example of a condition in which the antibody is present, anti-mitochondrial antibody, primary biliary cholangitis. And when we are talking about primary sclerosing cholangitis, it is going to be having the presence of an antibody that is given the name of p-ANCA. When I'm talking about p-ANCA is nowadays called by the name of MPO-ANCA. What are the example of vascular disorders which are going to be having MPO-ANCA? Vascular disorders which are having MPO-ANCA: microscopic polyangiitis, EGPA, Goodpasture syndrome. Fourth condition is what we are talking about now, which is going to be ulcerative colitis. Which condition is having the presence of PR3-ANCA? Which condition is having the presence of PR3-ANCA? Of course, you know the answer. PR3-ANCA is going to be a feature of a patient who is going to be having GPA, granulomatosis with polyangiitis. This is the most important slide that we have to take care of before we say goodbye to each other, except for the tumors. But alpha-1 antitrypsin deficiency, INICT question. Patients are going to be having autosomal recessive issue. This is what you need to remember as an abnormal thing. Normal is going to be PIMM. Normal is going to be Papa and Mummy. Papa and Mummy, PIMM is what is going to be normal. But when you are going to be eating pizza, that is not good for your health. So it is going to spoil the health of lungs and liver. So that is what is going to be responsible for causing pan-acinar emphysema as well as cirrhosis. These patients are going to be having a high risk for development of liver cirrhosis. And the problem that the patients are going to be having is abnormal protein is going to get deposited in the liver. The abnormal protein is going to be appearing in the form of pink to magenta colored granules. Pink to magenta colored granules, which are going to be given the name of PAS positive diastase resistant granules. Then what is going to be a revision point for most of you is going to be hemochromatosis, also called as bronze diabetes. Pancreas is involved, liver is involved, skin is involved. Too much of absorption of iron because of HFE gene problem. HFE gene problem responsible for causing too much of iron absorption. Now, because you are having too much of iron, so that causes Fenton's reaction, that causes a lot of free radical formation, and that is what is going to be causing the trouble in the patient. How would you see the presence of extra iron? By the presence of hemosiderin, and hemosiderin is going to be detected with the help of Prussian blue or Pearl's reaction. So confirmatory test over here is going to be liver biopsy. Liver biopsy. That's what is to be remembered over here. What's the best treatment for a patient who's going to be having hemochromatosis? You're going to be doing regular interval phlebotomy. Otherwise, you can be giving iron chelatus. right? So this is an important question. Then we got a question in the exam which was on Wilson's disease. Wilson's is a problem that is going to be affecting the liver. It is going to be affecting eye and the brain. Very, very importantly asked question. ATP7B is what is affected. It is present on chromosome number 13. So patients are having liver problem. They are going to be having the presence of liver cirrhosis. Basal ganglia is affected. So features of Parkinsonism. And the patients are going to be having the presence of ocular manifestations, sunflower cataract and Kaiser-Fleischer ring. Kaiser-Fleischer ring. Interesting feature about Wilson's is the patients can be having hemolytic anemia. And this is going to be an example of a Coombs negative anemia. Coombs negative hemolytic anemia. Too much of iron can be confirmed with the help of liver biopsy. Too much of copper also is confirmed with the help of liver biopsy. That was a question asked in the NEET PG exam 2024. So you're going to be having liver biopsy, which is going to be the confirmatory test for showing the excessive deposition of copper. And copper is going to be having a brown red appearance. Rhedanine is a color. Rhedanine is a stain that is being used. So instead of calling it as rhodanine, rhedanine is what I want you to remember. Red brown color of copper is what is going to be seen. Or the alternative that you are having over here is Ornstein stain. Ornstein stain, right? So the presence of serum copper, the presence of ceruloplasmin, all those are not going to be useful for making a diagnosis of Wilson's. But what is going to be useful for making a diagnosis of Wilson's happens to be the liver biopsy, which is going to be showing you extra amount of copper being deposited in the liver of the patients, right? So that is what you need to remember. Why all these conditions are bad news for a patient? Because all these conditions in some way are going to increase the risk of development of liver cancer in the patients. The moment I am talking about something like liver cancer in the patients, I am reminded of these example of tumors. And what we are not talking about over here are going to be certain questions which are going to be asked in the exam. The first one is going to be cavernous hemangioma, an example of a tumor which is going to be highly vascular. So you should try to avoid biopsy in these patients because otherwise your patient can sometimes bleed to death. This is what is going to be associated as a benign tumor, but associated with a syndrome that is given the name of KM syndrome or Kasabek-Merritt syndrome. Kasabek-Merritt syndrome, that is what you need to remember. Another one that you need to remember over here is a patient who's going to be having hepatic adenoma. Hepatic adenoma is a patient who's going to be having a history of intake of steroids. So males who are going to be taking anabolic steroids when they go to a gym, females who are going to be taking steroids when they're going to be recently married or they're sexually active but they don't want a kid, so they're consuming OCPs. Very important, female consuming OCPs, male consuming anabolic steroids, hepatic adenoma. Why we need to talk about this is also because of a third reason. This is the INA question asked in the exam, FNH. FNH is an example of a condition which is given the name of focal nodular hyperplasia. These are the patients who are going to be having the presence of a stellate scar. Remember what we talked about earlier, time and again, what me I would also recalled you, stellate granuloma is a feature of cat scratch disease. Cat scratch disease, right? Stellate scar is what you're going to be associating in the liver in association with a condition which is given the name of MFNH, that is focal nodular hyperplasia. That's what you need to remember. Talking about angiosarcoma, indirectly asked question in the exam because angiosarcoma is an example of a tumor arising from angio means blood vessel. So it was obviously going to be arising from endothelial cells, and you're going to be having tap your brain for angiosarcoma. That is what we have talked about earlier. Thorotrast, you're going to be having arsenic and you're going to be having polyvinyl chloride, which is going to be causing the development of this kind of a tumor in the patients. In fact, that is what is asked you as a radiology question as well. That is the reason why Thorotrast has been discontinued or it is not being preferred. Thorotrast is thorium containing radio contrast material. It is not preferred because it can be responsible for causing development of angiosarcoma. HCC is what was asked as a question, which was a fairly easy question. Marker of HCC was asked as a question in the match the following types. This is having a marker which is given the name of alpha fetoprotein. It's an example of a tumor which is going to be a malignant tumor in the case of adults. Risk factors are known to most of you: hepatitis B, aflatoxin, and liver cirrhosis. Of course, you're going to be having the markers over here in case of HCC like arginase 3, arginase 3. But there is one particular type, of hepatocellular carcinoma that is going to be different from the other subtypes, which is given the name of fibrolamellar variant. Why? Because this is going to be seen in a younger age. It is not going to be having the classical risk factors. It is going to be having good prognosis. It is going to be having a tumor marker, which is given the name of neurotensin. Neurotensin. So it is going to be having a relatively slower growth because of the fact it is going to be seen in case of younger individuals, not classical risk factors. Why is the cancer seen then? If it is not associated with hepatitis B, hepatitis C, liver cirrhosis, why is it going to be seen? Because it is going to be having a very unique type of a DNA. So एक अलग प्रकार का cancer causing DNA जब आ जाता है, दैट्स हाउ वी रिमेंबर इट। अलग प्रकार का कैंसर कॉजिंग डीएनए जब भी आ जाएगा तो पेशेंट को फाइब्रोलैमेलर कैंसर हो जाएगा। Fibrolamellar cancer. So this is a unique signature molecular mutation that is going to be responsible for causing fibrolamellar variant of the hepatocellular carcinoma. So it is saying in younger patients having neurotensin as a marker, no classical risk factors is going to be seen in case of equally both males and females as the books make a mention traditionally. And of course, is going to be having a better prognosis in comparison to the classical hepatocellular carcinoma. This is live. What do you think that is going to be required? No, it is not. We are live. Ladies and gentlemen, we are live. So that's what we need to remember. That is what we need to be familiar with. So I think this is your doubt so far as the day second is concerned. So you are just checking out on the fact whether you are as awake as I am or I am as sleepy as you are, right? No. Wonderful. Very nice doubt. Very nice question. Nonetheless, I hope that it has been taken care of. All right. अच्छा वही प्रकार का म्यूटेशन वाले से लगा उसको ऐसा। डॉक्टर तौसीफ कह रहे हैं ब्रेक ले लो भैया, ब्रेक ही ब्रेक है इसके बाद, ये देखो। खुशी खुशी ही खुशी आपके चेहरे पे मुस्कान, बिकॉज ऑफ द फैक्ट दैट वी हैव जस्ट फिनिश्ड ऑफ विद द टॉपिक एंड दीस वर द क्वेश्चंस आस्क्ड इन द एग्जाम। एक आधी चीज जो एग्जाम के डिस्कशन रह गई वो हमने इनडायरेक्टली डिस्कस कर ली थी। व्हाट वाज द मार्कर फॉर अल्जाइमर्स डिजीज? वी वर हैविंग द प्रेजेंस ऑफ, मेरा नाम ले लो सर, अच्छा जी आपका नाम ले लेते हैं, मनोज। ठीक है, ए बीटा इज व्हाट इज गोइंग टू बी सीन, ये वाला। जेनेटिक्स ऑफ बायोकेमिस्ट्री में पढ़वा दो यार, ऐसे मत करो यार। 11:30 पे यू कैनॉट से डॉक्टर गोविंद ड्रग्स। Flip protein is responsible for inhibition of caspase 8 dock. Absolutely right, Dr. Vaishu. And why is that important? Is because you have certain viruses like cytomegaloviruses, which are responsible for the secretion of these proteins, because of which they are going to, kind of save themselves. ठीक है? So, अरे वो कोई स्टोरी नहीं है, बनाई हुई स्टोरी है यार वो। ऐसी कोई स्टोरी नहीं है। हाउ कैन यू एक्सपेक्ट समबडी टू हैव अ क्रॉनिक अमीबियासिस? आई मीन व्हाई वुड यू डू इट ना? मैं तो दुश्मन के लिए भी नहीं चाहूंगा, तुम मेरे लिए चाहते हो ये। फ्रंटोटेम्पोरल डिमेंशिया में पिक्सेल्स। अच्छा, फ्रंटोटेम्पोरल डिमेंशिया पिक्स डिजीज का जो क्वेश्चन आया था वो जो था, दैट वाज अ जेनेटिक्स क्वेश्चन व्हिच वाज आस्क्ड इन द एग्जाम, दैट इट इज हैविंग द प्रेजेंस ऑफ हेक्सान्यूक्लियोटाइड रिपीट्स। हेक्सान्यूक्लियोटाइड रिपीट्स। अच्छा, giardiasis, पेप्टिक अल्सर डिजीज, यू आर गोइंग टू बी हैविंग द प्रेजेंस ऑफ ट्राइकोमोनियासिस, अमीबियासिस एंड सुडोमोनास कोलाइटिस। ठीक है। ये कौन है? डोरेमोन। डोरेमोन चेक कर रहा है। अरे डोरेमोन, तुम चेक कर रहे हो कि मुझे फार्मा आती है कि नहीं आती? पढ़ाई का एक ही फंडा है भाई, बहुत मेहनत करनी पड़ती है, रिवाइज करते रहना पड़ता है, हम सब भूलते हैं और हम सब एक ही जैसी सिचुएशन के अंदर है। सो यू डोंट नीड टू वरी राइट टू मच फॉर द एग्जाम्स। कल के क्वेश्चंस कितने हैं? कल के क्वेश्चंस होंगे यार ऑलमोस्ट लाइक व्हाट दे टॉक अबाउट इज एनीवेयर बिटवीन 60 to 75। मेरे पास है ही नहीं भी क्वेश्चंस यार, बन के ही नहीं है। बैड मेमोरी वाला गैजेट चाहिए तुमको? हो जाएगा यार। यार इतना अपने आप को अंडर एस्टिमेट क्यों कर लेते हो यार? इतना तो अगर मतलब वैसे पढ़ जाओगे ना, मतलब हिंदी थोड़ी सी बोलूंगा, इतने शिथिल पढ़ जाओगे तो कैसे काम चलेगा? देखो दुनिया तो वैसी, मतलब मैं वो शब्द का प्रयोग करना नहीं चाहता, दुनिया तो तुम्हें पता ही है कैसी है। ठीक है। तो रिश्तेदार उससे ज्यादा महान होते हैं, तो वो तो तुम पे हमेशा डाउट करेंगे ही। तो दे विल ऑलवेज कीप ऑन डाउटिंग योर एबिलिटी एंड व्हाट कैपेबिलिटी ना। तो तुम तो कम से कम एटलीस्ट यू डोंट बिकम अ कैटलिस्ट इन देयर थॉट प्रोसेस ना। एटलीस्ट रिमेंबर द फैक्ट दैट यू आर गोइंग टू बी डूइंग समथिंग बेटर फॉर योरसेल्फ। My point is the simple take home point that I kind of choose when I wish to attend a class or something is that after attending a class, am I better than what I was? If you are better than what you were, then the purpose is solved. Now, depending upon the individual, somebody can be having a benefit, which is, let us say, for 5 questions. Somebody can be having a benefit for 10 questions. Somebody can be having a benefit for 20 questions also. My point is that you should be kind of investing your time very judiciously over here. If you are going to be having a feeling that you are able to recall something, if you are able to revise on your own, please do it by yourself. Not a problem. The purpose of having a live class is that you should not be having a feeling which some of you rightly said कि सर अभी ये recorded है या live है। तो आपको ये पता है कि that you are going to be having, मतलब you are sitting along with a cohort. There is a cohort of 500 people, right? So you're not the only one. So there are 500 people all struggling for the same thing, all making the same effort, including your faculty. So you will always have a feeling that you are in a group. And whenever you are in a group, it gives you a protection. मतलब PSM के अंदर पढ़ते हो ना, herd immunity होती है। So in a herd, you always get that immunity that we will all do it. I am not the only one who is not answering. देखो जितने लोग आंसर करते हैं, 5 या 6 लोग करते हैं क्वेश्चन को आंसर, इसका मतलब 500 में से 490 लोग ऐसे हैं तो सोच रहे हैं आंसर. सो दीज 5 पीपल विल डेफिनेटली गेट अ बेटर रैंक, इसमें तो कोई डाउट नहीं है. बट जो 490 लोग हैं, उसमें से कौन बेटर परफॉर्म करेगा, जो ज्यादा रिवाइज कर पाएगा. राइट. सो दैट इज द ओनली थिंग दैट यू नीड टू रिमेंबर. जीटी के स्कोर पे भी, जीटी इज एन एग्जांपल ऑफ अ सेल्फ एनालिटिकल स्कोर. Why the purpose of giving a GT is because at times when you are having a fluctuation, again I say the same thing. You can never be having a GT in which you score zero. It means you know something. So that is a icing on the cake. That is a silver lining, right? You cannot have a situation where you get a 100% score in GT. So that means there is still a scope of improvement. So after every GT, you have to keep on learning something, 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 something. And there is a fair possibility that in some of the GTs, some questions are going to be beyond your comprehension. तो उसमें तो कोई प्रॉब्लम नहीं है. जो मुझे बिल्कुल ही नहीं आता, मैंने अब जीन्स के, फ्यूजन जीन्स के नाम ही नहीं सुन रखे. अरे आई यू गिव मी अ क्वेश्चन ऑन समथिंग लाइक दैट, सो आई विल नॉट बी एबल टू गेट इट करेक्ट, सो डोंट गेट डिप्रेस्ड अबाउट इट. द मेन टेक होम मैसेज फ्रॉम अ जीटी इज दिस क्वेश्चन वाज विद इन माय रेंज. ये मेरी शूटिंग रेंज के अंदर था, जैसे सोल्जर्स करते हैं ना, ये मेरी रेंज के अंदर था दुश्मन. डिड आई मिस हिटिंग ऑन दिस क्वेश्चन ऑल्सो? That is something which has to be avoided. Now, it will never come with a single practice. It will never come in a single day. So, the more the number of GTs that you take, you will always remember. जैसे अभी मैं आपसे randomly questions पूछ रहा था. So, you are giving, you know the answers. मैं मान ही नहीं सकता कि आपको वेटिफ्लॉक्सासिन नहीं पता था, या आपको बेवफा वाले ड्रग्स का कोई नाम नहीं पता था, बट आपको अमाइनोग्लाइकोसाइड्स के एग्जांपल नहीं पता थे, या फिर आपको पता नहीं थे कि कौन सी ड्रग्स होती हैं विच आर गोइंग टू बी हैविंग एन एंटी कैंसर वाला एक्शन. You have heard about these drugs, but you were not able to recall. Now imagine, आज अगर recall नहीं हो पा रहा, you still have time. You still know कि अच्छा ये topic मेरे को पढ़ना है अभी. I still have to revise this topic. But imagine this thing happening to you on the day of the exam. बहुत लग जाएगी ना. तो वो जो problem है उसको हमें avoid करना है. And therefore we have to constantly remind ourselves that there is a scope of improvement and this is what we have to do. Right? So आधा दिन की क्लास का पर्पज यही है कि बाकी आधा दिन आपका अपना है. आप उसको स्क्रू अप मत करो. आप इसको देखो कि आपके पास ऑलरेडी पीडीएफ आ चुका है, आपके पास ऑलरेडी नोट्स आ चुके हैं. इसमें से कौन सा ऐसा टॉपिक था, यार मेरे को हिमैट आती है, मेरे को नियोप्लाजिया जीपैथ नहीं आती. सो हिमैट और जीपैथ मैं आराम से पढ़ लूंगा यहाँ पे. मेरे को सिस्टमिक आती है या फिर सिस्टमिक नहीं आती. सो वट एवर टॉपिक्स यू आर एबल टू आइडेंटिफाई कि दिस इज व्हाई आई हैव अ टेंडेंसी टू फॉरगेट. सो दैट इज व्हाट इज इंपॉर्टेंट. नाउ व्हाट वी आल्सो डिड इज वी इनडायरेक्टली रिवाइज लास्ट 5 year questions. All of you have practiced your PYQs more than once by this point of time, hopefully. एक बार तो सबने कर लिए. तो आपको एक रियलिटी चेक मिलता है, हाउ मेनी PYQs कैन आई रिमेंबर नाउ at this point of time in a real world situation. So it means if I'm not able to recall the PYQs, what does that mean? If all the questions in the exam, the NEET PG come from only the PYQs, even then I'm not getting a 100% score. And that is something which has to be worked upon. Right? So if you say that I am not able to read something and remember something in the first reading, you are normal. If you are saying that I read this topic, I am forgetting, you are normal. If you say that I am not able to recall everything 100%, you are again normal. So why do you want to feel abnormal यार? अगर पहली बार में याद हो जाएंगी चीजें, कभी भूलोगे ही नहीं, कभी रिवाइज करने की जरूरत नहीं पड़ेगी, तो तुम तो भाई जीनियस बन जाओगे ना. मैंने तुम्हें पहले ही बोला था ना जोक. वो जो लोग होते हैं ना, वो ऑरेंज कलर की पोर्शा चलाते हैं. लेकिन वो लोग जो ऐसा नहीं कर पाते, वो नॉर्मल लोग होते हैं, आपके मेरे जैसे लोग होते हैं. और ट्रस्ट करना, अगर हम पोस्टर नहीं चलाएंगे तो भी कोई चिंता की बात नहीं है. हम भाई बीएमवी चलाएंगे. ठीक है. फर्क कितना होगा, कोई 5 साल में चलाएगा, कोई 7 साल में चलाएगा, कोई 10 साल में चलाएगा. अभी द पर्पज इज दैट वी हैव टू गिव अवर बेस्ट शॉट फॉर द एग्जाम्स. टुमारो यू शुड नॉट बी हैविंग अ फीलिंग दैट आई डिड नॉट गिव माय बेस्ट शॉट. मैं तेरे को सिंपल चीज बता देता हूं. I have met everybody in the stream, right from somebody who gets a rank 1 in ideology and somebody who's going to be, picking up a branch like even anatomy. तुमको लगता होगा एनाटॉमी कमजोर लोग लेते हैं, लेकिन ऐसा नहीं होता. एनाटॉमी करके अगर आदमी हिम्मत करे, मेहनत करे, तो वो फेलोशिप कर सकता है एम्ब्रियोलॉजी के अंदर और वो आईयूएस सेंटर स्टार्ट कर सकता है. इट इज अ माइंड गेम. इट इज प्योरली अ माइंड गेम. तुम दुनिया भर के इंस्टाग्राम इन्फ्लुएंसर्स को, यूट्यूब इन्फ्लुएंसर्स को देखते हो, इनके पास डिग्री नहीं है, ज्ञान बेच रहे हैं वो. तुम तो पढ़े लिखे हो यार, एमबीबीएस हो, तुम अपने आप को ऐसे अंडर एस्टिमेट कैसे कर सकते हो? ठीक है. तो फिलोसफी के लिए भी एक चीज याद रखना, दैट यू हैव अ स्पेशल एलिमेंट इन यू. सबको पता है ना कि स्पर्म काउंट कितना होता है, नॉर्मल फिजियोलॉजिकल स्पर्म काउंट. देयर आर मिलियंस एंड मिलियंस ऑफ देम. किसी जमाने में, आई वुड नॉट लाइक टू गो इनटू द डिटेल्स, किसी जमाने में उन लाखों करोड़ की भीड़ में से तुम एक थे जो जीते थे. तो तुम अपने आप को अंडर एस्टिमेट कैसे कर सकते हो? ठीक है. तो कभी भी डाउट हो ना, तो तुम्हारी एग्जिस्टेंस एक प्रूफ है कि तुम टॉपर हो. ठीक है. द फैक्ट दैट यूर एग्जिस्टिंग इज द फैक्ट दैट यू आर अ टॉपर यार. यू आर द बेस्ट. सो यू आर द बेस्ट अमंग्स मिलियंस. ये तो 1 सवा लाख लोगों का एग्जाम है, इसमें तो कर ही लोगे. ठीक है. तो इसीलिए नहीं, कोई तुक्का नहीं लग गया भाई। ये अगर आपने हमको बोलोगे तुक्का लग गया हर चीज में, तो आप अपने आप को अंडर एस्टिमेट कर रहे हो ना। सो यू गेव अ प्रूफ राइट एट द टाइम ऑफ योर एग्जिस्टेंस, राइट? सो जस्ट ट्राई वट एवर यू आर गोइंग टू बी डूइंग एंड जस्ट गिव इट अ बेस्ट शॉट। ठीक है, अब रात के लिए इतना काफी है, तो अपने दिमाग को थोड़ा सा रिलैक्स करना, राइट? जस्ट रीड एज मच एज वी पॉसिबली कैन, ट्राई टू अंडरस्टैंड एंड आंसर द क्वेश्चंस. It is hopefully not going to be too difficult, but it is going to be something which is going to be just going to be important for the purpose of having a discussion. ठीक है, कोई बात नहीं। तो मोनिका, अगर एक फिजियोथेरेपिस्ट लेजर के यूज कर सकता है और पैसे कमा सकता है, तो तू भी तो कमा सकती है। तू ऐसे टेंशन क्यों ले रही है? वाई आर यू अंडर एस्टिमेटिंग योरसेल्फ? ठीक है, चलो अपना खाना आराम से खाओ, टेक केयर ऑफ योर हेल्थ, try to do something good and worthy and make your family and your parents proud. Of course, if you do make them proud, we are also going to be equally proud of you, right? So God bless each one of you. Do take very good care of your health, and we'll catch up tomorrow, right? Bye bye. ये देखो, ये शुरू हो गई। मोनिका, तुम कौन से शहर की हो? बस कर भाई, बहन है वो, राखी बांध देना मोनिका से। बाय। बहुत शानदार फातिमा, मैं अभी गया नहीं हूँ, मैं अभी देख रहा हूँ। अच्छा, कैट ट्रिप। कैट ट्रिप क्या करो? लो भैया, मैं ही कर देता हूँ तुम्हारे सामने, भूत बन के आ जाऊंगे। कितनी इनोसेंस है ना तुम्हारे अंदर। कोई कह रहा है आशीर्वाद दे दो, बिल्ली से आशीर्वाद दिला दो तुम्हें, मियाओ मियाओ करके, मियाओ मियाओ। खुश हो जाते हो वैसे, एग्जाम में याद रखना ये। चलो जी। अबे नैनीताल का तो पानी सूख गया भाई, 5 मीटर कम हो गया पानी। ठीक है, चलो, ऑल ऑफ यू आर गोइंग टू बी डूइंग वेल यार, जस्ट कीप सम फेथ इन योरसेल्फ, जस्ट हैव सम फेथ इन योरसेल्फ। और डाउट हो तो हमेशा अपने आप को देख लेना, करोड़ों में जीतने वाला, करोड़ों में जीतने वाला, करोड़ों में जीतने वाला। ठीक है, चलो बाय, विल कैच अप टुमारो, टेक रेस्ट, गुड बाय।